Right, good afternoon, everybody. Now, Ms. Brahmi.
Thank you. Good afternoon, my Lord. The next witness is Gillian Duncan. Her statement, reference for the record, is SCI WT 0372 501.
Very good. Thank you very much indeed. Now, good afternoon. Please come in and make yourself comfortable.
Thank you.
Thank you. Ms. Brahmi, when you're ready.
Thank you, my Lord. Good afternoon, Mrs. Duncan.
Good afternoon.
Please, could you confirm your full name?
Yes, it's Gillian Sarah Duncan.
Thank you. And the inquiry has your birth of date and contact details, is that correct?
That's right, yes.
Thank you. You're currently employed as a part-time sales assistant.
Yes.
And before the pandemic, you were an actress.
Yeah.
Thank you. You live in Edinburgh with your husband and 2 sons, is that correct?
That's right.
Yeah. Thank you. And you're here today to give evidence about your mother and father. They were both in the same care home in Edinburgh.
Yeah.
Thank you. Now, you can mention the name of the care home, but please don't mention the name of any individuals who worked there or any of your family or friends.
Okay.
Thank you. Now, we know from your statement that both your parents sadly died during the pandemic.
Yeah.
Your mother's cause of death was recorded as COVID and Alzheimer's.
Yes.
And your father's cause of death was recorded as COVID.
Yeah.
But there was some mention of, your father's cause of death was recorded as Alzheimer's, but there was some mention of long COVID.
Yeah, residual
that
COVID,
wasn't,
they called it. Yeah.
Residual COVID, but that wasn't recorded on the death certificate.
Exactly, yeah.
Thank you. Now, your parents were both residents at North Care Manor, which is a care home in Edinburgh.
Yes.
Correct. Thank you. And I understand from your statement that your mother was diagnosed with Alzheimer's in 2013.
Yes.
Okay, thank you. And your father looked after your mother until he also started to show signs of Alzheimer's in mid-2017.
Yes.
Thank you. And at that point, you and your sister started to assist with your parents' care.
Mm-hmm. Yes.
Thank you. And in December 2017, your mother was hospitalised suffering from flu.
Yes, that's right.
Yeah. And a week later, your dad was also hospitalised in the same ward for the same illness.
Yes.
Thank you. And you say that in your statement that at the time of discharge, social workers had said that your parents couldn't return to the home. Is that correct? Yep. Was that because of the extent of Alzheimer's?
It was. Both my parents also had delirium with the flu, that it seemed to bring this on. And my mum went back to what was called a baseline normal, and my dad didn't. It was felt that being in the home their home wasn't suitable for them anymore.
Okay, thank you. But initially, you and your sister were able to convince them otherwise, and you were able to put in place 24-hour care in their home. And through Edinburgh Council, is that right?
It was not through Edinburgh Council.
Okay.
We got direct payments through Edinburgh Council.
Okay.
We sorted our own care out through a company called Bluebird Care. I think I'm allowed to say that, am I?
Yes.
Yeah, we went against what the social workers advised because we just felt we wanted to give our parents a chance at home with a 24-hour carer before we went to a care home, which was our last resort, as it is for most families, I think. So we tried.
Yeah. Thank you. And you mentioned that your father's baseline hadn't returned to what it was before. And was it as a result of that after 6 weeks the situation was reviewed?
Yes, it was. I think we realised very quickly that it wasn't going to work. Our mum accepted the carer, but our dad just couldn't. And I think with his delirium, he was confused about where he was. Was he in a home? Was he in a hospital? And it just wasn't working. And me and my sister just thought, actually, at least we tried. But it's more important now that our parents are safe, and it was difficult with the stairs in the home. We were having to be there a lot of the time, although we had young children. We were happy to be there, but it was just not working. So we had to just go to our absolute last resort, and a care home was the only option that we were left with.
Thank you. And the care home, they moved into North Care Manor in 2018. Did you and your sister choose that home?
We did, yeah.
And were you happy with the care your parents were receiving there prior to the pandemic?
We were, we saw many care homes. I think there was about 10 care homes we looked at, and we chose that one. We were happy. However, care homes are not perfect places, and me and my sister were in there a lot, several times a week for hours at a time, and we oversaw everything. So if something wasn't right, we just fixed it. You know, we had a good relationship with the owner, and we managed it. We managed it that way.
So you were able to go to the owner if any issues arose? Yeah.
We realised that the care home manager had no power. And we thought, right, we got to know the owner, and we thought, right, it's her we'll go to. And she was good with us, actually.
Great, thank you. And what kind of things were your parents able to do in the care home?
Well, I mean, you know, our parents were that had Alzheimer's, and it was getting to quite a sort of a difficult stage. But what they were able to do was when we were with them, that everything, we always said, we just want things to be normal, for want of a better word. We want them to feel comfortable, to feel everything's familiar. So we decorated their rooms a bit like their home. We had pictures up, we had books, we had CDs, we had lots of stuff there. And we just made it work. Our parents were able to go out, so we would go out on little trips, sometimes down to the coast, or we took them to see the Queensferry Crossing, and we took them to see the Christmas lights, which they enjoyed. And there was a cafe in the care home, which was lovely, and it was open to the public, and we would take them there. And then things felt normal because we were there, and there was we got to know other people there, and we made it work.
How often did you visit?
I would say it was about 3 times a week. Sometimes more, sometimes less, depending what was going on. But there was 2 of us, so we managed it between us. So.
And when you visited, how long would you typically stay for?
Gosh, hours, actually. You know, we were never like a sort of in and out in half an hour. We were sometimes a whole day. Go to the cafe, have lunch with them, maybe take them for a walk, and then we would go, and then we would have an evening meal and watch a film. I mean, we were able to be there as much as we wanted. So, took the kids in and did all sorts, really.
Thank you. And you say in your statement that there were about 70 residents in the home, and it was over 2 floors?
Yes. So it was 70. I'm not sure if it was actually at capacity, but I know there was room for 35 people on the ground floor, and that was for people that had Alzheimer's and cognitive issues. And on the floor above were people that needed care, but they didn't necessarily have any kind of dementia. So,
Thank you. And you said that you'd been able to set up your parents' home room to make it feel like home. And were your parents in the same room?
No, most care homes now, the sort of modern ones, is all single rooms. So my parents had to have their own separate rooms. They were quite big rooms, though, and they were en suite, but Dad's was right next to Mum's. But they spent all their time in Mum's room. So that was just like their kind of, it was like their living room, and then, you know, so, that's what it was like.
Now, there came a point where the care home locked down because of the pandemic. Is that right? Do you recall when that happened?
Yes, it was the 13th of March that it locked down. So I think 10 days before the sort of lockdown in the country happened, I think.
Yes. And how was that communicated to you?
Well, it was quite quickly. It was kind of, I think it was maybe just a few days warning. Can I just elaborate on that a wee bit? Because me and my sister had been obviously watching the news. You couldn't really avoid it, and we'd been hearing what the WHO were saying. So we knew what was kind of coming, and we were terrified for our parents. So it was no surprise when the care home locked down, basically.
Yeah.
We were kind of prepared for it. We were ready for it, although we thought it would only be a few weeks.
Yes.
We didn't realise it would be as long as it was, you know.
Yeah. And just for clarity, when you say you watched the news and knew what was coming, what was it that you were seeing in the news?
Well, it was basically, actually, it's on the screen. So what we were seeing was the fact that there was a virus, and it was in China, but it was spreading really fast. And our fear was that it was causing absolute devastation in care homes in Italy and Spain at that time, we could see. It was around this time the WHO, World Health Organization, advised test, test, test. We kind of felt that our government in Scotland weren't doing this, and we knew that that's what they needed to do because we had read about asymptomatic transmission, and we were really, really worried. The thought of a lockdown really terrified us, though we knew our parents needed to be protected. And we did agree with the care home lockdown, and we were glad that they set it up earlier than the Scottish Government did. We agreed with it at the time.
Yeah, thank you.
Thought it wasn't going to be for very long, of course, so yeah.
Yes, and we'll come back to some of those points.
Okay.
But initially, I want to know, were your parents able to see each other when the care home locked down on the 13th of March?
They were. Our dad had a fall and he ended up in hospital for a couple of days. But when he got back from hospital, I think it was around the 15th or 16th of March, we said to them, can they be together in their room? And they were.
Okay.
Until my mum tested positive for COVID, and then they were separated and they never saw each other again.
Okay. Do you know how your parents felt about the lockdown?
I don't really know how much they understood at all.
Were you able to discuss it with them?
Yeah, we did. I think the care home, we went in the night before the lockdown happened, and we did. We just said, oh, look, there's this flu going around, and we're going to have to wear masks, and it all feels a bit strange, but we can't come in for a while because we need to all protect each other. And we did explain, but my mum and dad, with their Alzheimer's, that the memory was so short by then that they wouldn't have kind of remembered.
Okay.
You know, they wouldn't have remembered. Yeah.
Okay. And what effect, if any, do you think the lockdown and isolation would have had on your parents, given their Alzheimer's?
Well, I think terrible, really, because they were isolated within their room, and at one point my mum and dad could be together for a little while, and that gave us comfort. But with Alzheimer's, that caused confusion as well. But when they were isolated, they were apart from each other. I just think they had their TV, they had their books, but they needed one of us or one of the carers in there with them to talk through a TV programme, to talk through a book. And I can't imagine what it would be like for them being isolated with Alzheimer's. Yeah. Being isolated without Alzheimer's, when they fully understood what was going on, they would have coped with, but not with Alzheimer's. Yeah.
And are you saying that it would have been difficult for them to follow a book or a TV programme without input from someone else?
Yes. I think for my dad at that stage, because his Alzheimer's seemed worse, my mum used to watch a lot of musicals, and that probably saved her in a way, because she would watch Calamity Jane over and over again. And I think we said to the carers at the time, put on Calamity Jane, so she can hear the songs. And as we know, for people with Alzheimer's, sometimes the music and singing can stay in your memory. Yeah. So, yeah, it might have been a bit easier for my mum than our dad. Yeah.
Were the carers able to help with that, to watch TV with them, or?
I mean, they were great, the carers, but very quickly COVID got into the home. I don't want to jump on because I know you'll come to that. And I think the carers were run off their feet.
Okay.
Yeah.
Do you know what your parents were spending their day doing?
To be honest, I don't know. I think we were probably asking the carers, are you able to go in? Are you able to help out with things? Are you able to sit and chat? And they would go, yes, your parents are fine. We did hear that a lot. Your parents are fine. And I remember speaking to my sister one day saying, gosh, they always seem fine. Are they fine? But I think whether they were trying to protect us, I don't know. But I thought, I don't think they're fine all the time, you know. I'm not sure, but...
Yeah. And you mentioned that your father had a fall the day after lockdown and was admitted to hospital.
Yes.
Can you tell us what happened?
Yes, so it was the day after the care home lockdown. Yeah, and Dad had a fall, and he'd had a few falls, and the care
Good. Right.
Sorry.
On we go, and don't worry.
Thank you. Too easy to do it. Thank you.
Yeah, it's very easy to do that when you're giving evidence of a personal nature.
Yeah.
I have been asked, though, to remind you just to try your best
Try my
not
best.
to.
Yeah,
But
absolutely. That's fine.
don't worry about it, please.
Thank you.
Thank you. Now, I think you were telling us that after your father had his fall, you and your sister attended the care home.
Yes.
Is that right?
Yeah, so we got into the room and our dad was just in a terrible state and our mum was very confused. But we were able to say to the carers, look, you go and you help other people, because it was evening time, people were being put to bed and stuff, and we'll stay with our dad until the ambulance gets here. So that's what we did. We were able to do that.
Thank you. And were either of you able to go to the hospital with your dad?
My sister was. She went to the hospital and I stayed with my mum.
Okay.
Yeah.
And what did you and your mum do?
Yeah, it was, this is quite hard because this is the last time I was with her before she passed away, and my mum was quite confused about what was going on, so I remember we just put on Snow White and the Seven Dwarfs, the old Disney cartoon from the 1930s, which my mum loved as a child. And we sat there drinking tea and eating Turkish Delight, and it was Mum's favourite sweet. It kind of brought us comfort, and I think, Mum sort of calmed down because I was there with her. And then I think probably her memory had gone, and I remember just helping her get into bed. She was very tired, and so I was able to be with her for that time, which was nice. Yeah.
Thank you. Now, while your father was in hospital, were you contacted by a doctor and asked to sign a DNA CPR or do not attempt pulmonary? Do not attempt cardiopulmonary resuscitation order?
Yes, I was. Yes.
Can you tell us about that conversation?
Yes, it was. I think it was the next day I went in after Dad had been admitted, and it was just a doctor that asked me. It was all quite matter of fact. Would you sign this? And I did sign it actually, because my dad had had a few falls, and he was, with my dad's Alzheimer's, he seemed to be sometimes 1 foot in our world and 1 foot in the world of Alzheimer's, if that makes any sense. Sometimes he was quite lucid, and then he wasn't, and he was very distressed by this, and we just thought, this would be what Dad would have wanted. That's what we thought. Yeah.
And did the doctor explain to you why he considered it to be clinically appropriate?
No, he didn't at the time. No.
He just told you about the order and asked if you wanted to sign?
Yeah.
Okay, thank you. And was there ever a DNA CPR order in place for your mum?
No, not that I can remember.
Okay.
No.
And nobody had that conversation with you?
No, nobody had that conversation, no.
Thank you. When your dad returned to when did you told us your dad returned to the care home after a few days?
Yes.
Is that right?
Yeah.
Was he tested for COVID before he returned?
He was tested, actually, and he tested negative, so he went back into the care home. Yeah.
Thank you. And now going back to the part in your statement which you looked at on screen about the World Health Organization message of test, test, test.
Yeah.
Back in March of 2020, that you say in your statement that wasn't happening with care home staff, is that right?
That's right.
Yeah. Or visitors to the care home?
Nobody was getting tested. We knew that this wasn't in place. We were terrified about people taking the virus in, like the staff. No, the Scottish Government hadn't put any testing in place, despite the message of test, test, test. And the care home were crying out for the test as well, along with family members. I think the care home was powerless, really, to do anything about that.
Did they tell you that, the care home owner or manager?
Yes, they didn't have the tests, and they wanted them.
Yeah, they told you they wanted the test.
Yes, they did,
but they weren't.
yes.
Yeah. And you say in your statement that you were most worried about asymptomatic transmission.
Yeah.
Is that right?
Yeah.
What worried you in particular about that?
Well, I mean, this is what we were hearing on the news, asymptomatic transmission, and we heard about this very early on, and we just thought the carers unbeknownst to them, could carry this virus into the care home, could have COVID with nothing, no symptoms. And that's what we felt was probably the most dangerous part of the virus. And that's why we were crying out for tests.
Thank you. You also mention in your statement at paragraph 86, going forward a bit here, that Nicholas Sturgeon had mentioned that testing was not the Holy Grail.
Yeah.
But you say that in those early days, you felt that it was the only defence against the virus.
Yes, that's exactly what we thought. We thought it's the only defence that we have of it against this virus that nobody has any immunity to. So although she was saying it's not the Holy Grail, I think when she said that, I thought, does that mean you don't have the tests?
Okay.
That's how I took it.
Yeah.
I don't know if that was the case, but yeah, I felt it was the only defence that we had, and I would like them to have erred on the side of caution with people in care homes.
Yeah.
who were very, very vulnerable.
And you say you would have you consider that they were very slow in putting testing in place.
Yeah. Yes.
And so in March 2020, you say that there were no tests for staff, and you say in your statement there were only 5 tests for 70 residents.
Yes.
Is that correct?
We were given that information because me and my sister were asking for this all the time, asking for information, and we were told the care home had been allocated 5 tests for that amount of residents, and you could only be tested if you displayed symptoms.
Without mentioning anyone's name, who told you that?
It was, I think it was the care home owner.
Okay, thank you.
It might have been the care home manager. I'm not quite sure.
Okay.
So,
Thank you. In your statement, you say that it wasn't until the 25th of May 2020 that staff were being tested. And you say that members of staff tested positive despite being asymptomatic.
Yes.
Given your concerns, how did that make you feel?
it made us feel, it was traumatising. It was traumatising for us and the other families, I'm sure, and for those staff members. And I think I use this phrase, which is horrible, really, but I think it says it all. I said, I believe our parents were sitting ducks. Our parents didn't wander within the care home. They stayed within their own room, and I feel that the virus was brought into the room they were isolated in, and for them there was no escape. I might have that date wrong, actually. It might have been a bit before 25th of May,
Okay.
but I think it was around that time.
Okay, thank you. And you say in paragraph 89 of your statement that when routine asymptomatic testing became available for staff, it was only done once per week.
Yeah.
What did you think of that?
Well, I mean, we couldn't quite believe it was once per week. We kind of thought, surely it would be every time they came in for their shift. Or maybe that was too much, I don't know. Maybe twice a week. We thought at least twice a week. We were quite astounded that it was only once per week.
Do you know why it was once per week?
I think, my guess is they didn't have the tests. They didn't have enough. Our government didn't have enough to hand out,
Okay.
I think.
Yeah, but you didn't have a conversation about that with the care?
No, that was all that they were given.
Yeah.
That was all they were given. Yeah.
Okay. Thank you. Now, going back in your statement, while the care home was locked down, did you have any video calls with your parents?
Yeah, we had Skype calls, which we'd never done before with our parents. It was really, really unusual for us to do that. I remember one with my mum, and it actually worked quite well because there was a really nice carer with her, and she was sort of explaining the whole situation and what was going on. And I think when my face popped up on the screen, my mum started laughing. I remember she was laughing, and I remember taking her around my flat and showing her around the flat and stuff like that, and that kind of worked. There was another call I had with her where she started to cry. And I went, Mum, are you okay? I said, this is a really difficult situation. And she went, I'm crying because I'm happy. But I don't think she was happy. I think she was trying to make me feel better. I think she had that in her still, you know.
So the calls worked well with your mum, with the staff assisting.
Yes, with the staff, yeah.
How did the calls work for your dad?
They didn't work at all. In fact, Dad was distressed by the call for whatever reason, we're not sure, but he was really terribly distressed. And it seemed to cause more confusion. So we couldn't have calls with Dad after that, which actually meant that we had no communication with Dad.
Okay. Yeah. And how often would you have calls with your mum?
It was only once per week that we were allowed, because they were trying to facilitate calls for everyone in the care home. So it wasn't very often at all, yeah.
So did you feel there were enough staff in the care home?
Well, because we weren't there, we didn't know.
Yeah.
I felt there was never quite enough staff in care homes. It's a private care home, like most of them are in Scotland, and I always feel that there's never quite enough staff. We did raise this with the care home owner at night. We felt there wasn't enough staff, and we made a complaint to the care inspectorate. This was before the lockdown, due to a lack of staffing cover at night. Actually, the care home owner, she accepted this. We had been noticing that we went in one night about, I think it was about 7 o'clock to see our parents, and they were already in there ready for bed. And we were quite appalled at this, because we're like, our parents like to have an evening and not go to bed. But the day shift staff were trying to get people ready for bed to make it easier on the night shift staff. And we thought that was unacceptable. And the care home owner actually agreed with us. And she said they would be putting more staffing in place at night time. But then it locked down. And so we don't know if that ever happened.
Okay. And in fact, the care inspectorate agreed and upheld your complaint.
They upheld the complaint, yes.
Right. Okay, but you're not sure whether the care home owner, despite agreeing, did put in more staff or not?
I mean, sometimes we say we have enough staff, we have adequate staff, but I don't know what that means. Yeah.
Okay. And it seems that there weren't, however many staff there weren't enough to facilitate a Skype call more than once a week?
No, there weren't. No, we were trying to get photos. Could we send photos on something like WhatsApp? But that couldn't be done for some reason. Maybe it's because people couldn't use their private phones or something. But
did they ever explain to you why that couldn't be done?
I think it was just, they said it was a legal thing, that they couldn't do that. So, yeah, not in detail, really, but yeah.
So even just taking photos of your parents, they told you that there was a legal issue preventing them?
On WhatsApp. We thought WhatsApp would be so much easier for the staff, just to show them photos and things. But I think we emailed some in, but we don't know if our parents ever got them.
You emailed photos of?
Photos of us, of the family, just to keep things going and stuff like that, and tried to get them to send photos of Mum and Dad to see how they were doing. But it just became very difficult at that time.
Yeah, and you're not sure whether they showed the photographs. Did they comment on whether they were showing them photographs that you were sending?
I think there was a lot of confusion at that time, and there was so much going on that, no, I can't remember them commenting, no.
Now, I understand from your statement that just before lockdown, you telephoned the GP who covers the area that the care home's in. What did you call him about?
It was because I was so scared, because I had seen what was happening with care homes in Italy and Spain, and also we would see people on the news in ventilators, and by that time I had heard that people in care homes were not allowed to go to hospital. They had to be treated within the care home. And we were thinking, how would that work if somebody is fighting for breath, is suffocating? How would that work? And that's why I phoned the GP to see what would happen in that situation. And he said to me as well, he said, well, they wouldn't be taken into hospital, and they would instead be treated within the care home. I asked about oxygen or a fluid drip. I'm not medical, so I just, the basics. He said, worryingly, that would not be available within the care home. Care homes aren't hospitals. They would be given paracetamol to bring down a temperature if things progressed. And if things progressed, end-of-life medication would be prescribed and administered. Okay. That was it. That was it.
Did he tell you why that would be the case?
He just said this was public health. This was what the care homes had been told.
By Public Health Scotland?
By Public Health Scotland. and the GPs weren't going into the care home. So.
Okay. Did he tell you that only those in care homes couldn't access hospitals, or was this something that was to be across the general population? That
It seemed to very much be only people in care homes.
Okay.
Yeah.
So your parents wouldn't be provided with medical care that the non-care home population would. So essentially, if they could have stayed at home, they would have had access in the exact same health condition, state of health that they had. They would have been allowed access to hospital treatment, but because of where they were living, they were going to be denied that.
Yes.
How did you feel about that?
Terrible, angry, couldn't quite believe it, actually. We knew that the hospitals are not a great place for people with Alzheimer's. It causes so much confusion. So we didn't really want our parents to go to hospital, but if they needed to, of course, to get the correct medical care.
Yeah.
Our parents were doing okay in the care home. And Dad had a few falls and stuff, but Mum was sort of doing okay. So we thought, we need them to have proper medical care.
Yeah. And did you try to challenge that?
I don't think we did. I think we were all just so, oh gosh, there was panic.
Yeah.
At that time there was panic in the country, and we felt panic. We felt our government aren't prepared for this. Yeah. I don't know what we were thinking. We were very, very scared, really worried, off the scale worried, actually.
Yeah.
Yeah.
I think in your statement you mentioned that you discussed this with a GP and nurse at the care home. What did they say to you?
Well, they just said that's. I mean, I think the people in the care home, certainly the owner, was like, they couldn't quite believe that people weren't to be admitted to hospital, but they were just going with what they were being told. Yeah. And you've already mentioned that you were told GPs weren't to enter care homes. Who was to look after the residents? Well, our parents were in a nursing home. But a nursing home, I don't know if this is the same for all care homes, there was 2 nurses for 70 residents. So there was 1 nurse on the top floor and 1 nurse on the ground floor. But they would administer medication, take temperatures. You know, they were trained NHS nurses.
Yeah. So 2 nurses
Only
to
2
look after 70
for 70
people.
residents, yeah.
Okay. And you say in your statement that the care home told you that Public Health Scotland had told them not to tell families about people contracting COVID in care homes.
Yeah.
Is that correct? Was that just about the individuals who had contracted COVID, or was it numbers, or was it the fact that there was COVID in the care home?
It was so confusing because me and my sister were always saying, what's going on? Tell us what's going on. We need to know. And we were told, Public Health have told us not to give information to families, only to let you know if your own family member tests positive. And we were saying, but we need to know how many people have got COVID in the care home. We need to know that. And we don't need to know what individual person or names, but we need to get a picture of what's happening. But that information was denied, and it was Public Health Scotland that had given the care home that information.
Okay, thank you. Later on down the line, there came a point where you wrote to the Scottish Government about your conversation with the GP, is that right? As well as a range of other matters that caused you concern. What did you write to them?
So I wrote to the First Minister. I don't know, can I say the name? Or maybe not. The former First Minister.
Yes.
So I wrote to her, and shall I read what I said? It's in there, yeah. I expressed all my concerns in relation to testing, infection control and visiting in the care home. I asked for, this was after my parents had passed away, I asked for an acknowledgement that bad decisions were made which contributed to my parents' deaths, as well as thousands of other care home residents in Scotland. I also asked for an apology. Instead, I received a very unsatisfactory reply from a Scottish Government official. And both of these letters are with the solicitors, and a copy is available.
Thanks. Okay, and have the response that you received. Perhaps we could bring that on screen, please. The reference for that, for the record, is SCI WT 0372-502. Now, if you look at the screen, please, was that the response you received?
Yes. Yeah, that's it, yeah.
Thank you. And if we can scroll down, please, to the highlighted sections. I'm just going to read the sections that are highlighted.
Yeah,
just,
okay.
These address the points that I'm particularly interested in at this point. Now, the letter says that we recognise that not being able to see loved ones indoors in care homes has been particularly difficult both for residents and their relatives, especially those with conditions such as Alzheimer's disease like your mother and father. Where restrictions have been in place, these have always been designed to protect residents who are at high risk as well as staff from the virus. Then further down it states, throughout the pandemic, we have always been clear that essential non-routine visits should always be supported and have encouraged care homes to allow this. This should apply in circumstances where it would be beneficial for residents, such as those who have dementia or are in end-of-life situations, such as your parents' case. And then if we scroll down again, please. Then it says, there has always been a recognition of the fact that face-to-face consultations with a GP are still clinically necessary in some cases, and that they be allowed to continue to enter care settings, such as care homes, to provide ongoing care and support when required. And if we scroll down, I think there's a further section. Thank you. Oh, no, that's... sorry, if we could go slightly further up. Yes, just there. In terms of provisions, the final paragraph of that second page, it states, in terms of provision of oxygen, arrangements were made by NHS National Services Scotland to obtain additional oxygen concentrators to be made available to patients in the community, including care homes. If your mother required supportive or palliative care oxygen, this could have been requested and delivered to her care home where required. Health Board oxygen leads were in place to ensure that access to additional oxygen supplies could be ordered by other appropriate healthcare professionals working within the community to ensure that oxygen is available when required. Now, those statements made by the Scottish Government don't coincide with your experience, and they don't coincide with what the care home told you. Is that correct?
Absolutely not at all. None of it. None of it.
Were you ever able to find out why those the position put forward in the letter didn't transpire in your mother's case?
No, I think I was a bit broken when I got this letter. And also, the person who wrote it was from the Pandemic Response Adult Social Care, but this person didn't give their full name in the letter. They gave their, I'm not going to say the name.
Yes, thank you.
They just signed it with their first name, and they didn't give a surname. And I was quite amazed by that.
It's taken out in mine, but it is simply the first name, is it?
The first name, and it's first name printed, and it's been signed with a first name. And I kind of felt this is an official Scottish Government letter, and to me, that spoke volumes.
Spoke volumes about what? I mean, it doesn't seem to me to be a correct way to sign a formal letter, but you used the language that spoke volumes. What did it speak volumes of to you?
To me, what it spoke to me was they didn't maybe want me to come back and challenge, because I felt everything in this letter was very against what I had experienced. Or if I did come back and challenge, I wouldn't be able to get in touch with that particular person because I didn't have their full name.
See that?
That's what it said to me.
Thank you very much indeed.
Thank you. Did you ever speak to the care home owner about this letter? I know that this came at a later point, but have you ever spoken with her about this?
No, this was a few months after my dad died, so we never did.
Sure.
Is the situation therefore that what you were told by the care home owner, if it was the care home owner that spoke to you about it, was inconsistent with that which is in the letter you received from a person in the Scottish Government?
Yes. Yes.
And of course, I assume you're not able to judge which one of them was correct, but both of them could not be. Both of them could not be correct.
Yeah, I mean, I think we always felt that the care home were correct.
Yeah,
because
that's what you felt.
that's what we felt. Yes,
You may be correct in that.
exactly. That was my feeling.
You do not know. All you can say is that they were mutually inconsistent.
Exactly.
Yeah.
Yes.
Thank you, my lord. Now, your mother did ultimately contract COVID.
Yeah.
When did you find out that your mother had tested positive for COVID?
Well, I was on a Skype call with her, and I just noticed that she just didn't seem very well. And I said, she was just looking really tired and really sort of sunk into her chair, and her voice wasn't right. And I said, Mum, are you okay? And she was able to say to me, my throat's really sore. So I came off the call and I phoned the care home, and the nurse went in and took her temperature and found she was found to have a high temperature. So because she had symptoms of the virus, she was then able to be tested, and 2 days, they tested her there and then, and 2 days later she was tested, it was positive.
Thank you. Was your father also tested for COVID?
Yes, so because they were they were with each other a lot, so he was tested. He must have had symptoms as well, actually, but it was 2 days after Mum tested positive, Dad tested positive. Yeah.
And did your mother's symptoms of COVID progress? Did they become more noticeable?
Well, after that, it was very difficult to get Skype calls with her. Okay. It was. Things were happening in the care home, and it was very hard. And eventually we said to one of the carers, we have to have a Skype call with Mum, we have to see her. And the care home the carer was a little bit reticent. I think she was worried about our reaction, but we had to see her because we weren't able to get in, weren't allowed in. So that's when it was very, very hard, because we saw our mum in the bed, and she was struggling a bit to breathe. Okay. And she was sort of saying, love you, we're going to love you, she's saying, love you, and she couldn't, it was quite difficult for her to speak. And we just knew that she wasn't good, and we just felt that call, that might have been the last time we ever saw our mum. We had to prepare ourselves for that. We didn't know if she was going to come through COVID or not. We hoped that she would, but we didn't know.
Thank you. Did you, at that point, you'd already been told that she couldn't be taken to hospital. Yeah. Did you ask again?
Yes, we did ask again. We were asking about oxygen. We were asking about a drip. We were asking about, can Mum go to hospital? Mum needs obviously more care than the care home is able to give, because the care home isn't a hospital. Yes. And there was nothing. Mum got nothing. Yeah.
You mentioned in your statement that the care home told you that Public Health Scotland had told them that residents couldn't be taken to hospital, and that the care home owner had emails to that effect.
Yes.
Were you ever shown those emails?
No. The care home owner said that she had the emails to prove it, that Public Health Scotland had said that people in care homes can't go to hospital.
Okay, but she didn't ever show you?
I've not seen them. No.
Okay, thank you. Do you know how your mother's symptoms were treated?
It was paracetamol, and then it was end-of-life medication.
Okay. And you say in your statement that you were trying to prepare yourselves for your mum dying.
Yeah.
Is that because of how you saw her on the call?
Yes, and I think from what the care home. I remember speaking to the nurse in the care home and saying to him, do you think Mum was going to come through this? And he said, I just can't say. He said, she might, but I think you should prepare yourself for her passing away. And I think it was at that time I said to him, will you make sure that somebody's with her? And he said, we will do our best.
Okay.
But that felt awful to hear because I couldn't bear the thought of her being on her own.
Yeah.
Oh.
I think, did you often hear, did the care home ever call you to update you about your mother? Did you always call them?
It was us calling them.
Okay.
Yeah, it was us calling them. Yeah.
And I believe the last time you called the care home about your mother was on the 28th of April.
Yeah.
Can you tell me about that conversation?
So I phoned just to see how's Mum doing today, and the nurse I spoke to said to me, I think your mum is very close to passing away. And although we thought we were prepared, we weren't at all prepared. And I was thinking, gosh, why didn't they phone before?
Yeah.
And they said, you can come in, but you won't be able to come inside. But my mum's room had a patio door that went into the garden. They said, you can come there. And they were going, drive carefully, because it looked like it was going to be, I don't know, half an hour, I don't know. And I phoned my sister, and she lives further away.
Okay.
And then we both drove in.
You said you wondered why they hadn't called you. Did you ask them why they hadn't contacted you?
At the time, no, because we were just, we've got to get there. We've got to get there. That's all we were thinking.
Yeah. Did you feel that if you hadn't called them, that perhaps nobody would have called you?
Quite possibly.
How did that impact you?
I don't know. To be honest, I think at the time it was so awful what was happening. We weren't thinking too much about that. We were just thinking, get there. That was always think, get there and be with Mum.
Yeah. And so you did go to the care home.
Yeah.
And I understand from your statement that you wrote notes while you were in the car.
I don't know why I was doing that. I'd never been in that situation where someone had been at end of life, and I thought maybe Mum would be able to see me through the glass. So I was in the car writing, I love you, me and my sister are both here. We are here with you. And I don't know why I was doing that, because I was thinking I'll hold them up to the glass. Of course, when I got there, I realised that my mum her eyes were closed, and she was very, very close to passing away. And shall I go on? Is it okay to go on?
Yes, of course.
So the nurse and the carers were with my mum, and they opened the door, and I had full PPE on. I had a pinny on, gloves and a mask, but I was outside and I was 2 metres away from her. And the nurse and the carers were holding her hand. They were stroking her hair, and sorry. And I was just standing 2 metres away. I'm fine.
If you'd like to take a moment.
No, I'm fine. I just need to get through this. I was 2 metres away, and I understood. I couldn't be near her. I did know that. I wasn't going to break the rules. But it was hard, obviously. But I was there, and I was speaking, and the carers and the nurse were very kind, and they knew my mum, so I felt that she was being cared for in that moment. And I was trying to be calm, and I was trying to say calm things, but I don't think I was. I think I was crying out her name, and I was just calling her mummy, and I've never called her that since I was tiny. So I don't know. I was really trying, but failed. Yeah. And she did pass away. Yeah.
Okay. And so the carers were in your mother's care, in your mother's bedroom.
Yeah.
And your mother was in bed, is that
yes.
right? And they were by her side.
They did, and they angled her bed so she could see me. So we got as near as we could, but still with a 2 metres distance. But I was outdoors. I wasn't in the room.
Outdoors. So with full PPE, you weren't allowed by your mother's bedside at that point.
The door was open, but I was 2 metres away from it. Yeah.
Was your sister there at that time?
No, and this is just something that's really hard, because my sister lives further away, and she wasn't there when my mum passed away. She missed it by minutes, I just remember her coming into the care home garden, sort of running in, and I just shook my head. And I just remember her just sort of, I think sort of almost collapsing, couldn't quite believe that she'd missed her. Yeah.
What effect did that have on your sister?
It's been hard for my sister. It's been really hard, and I think she struggles with it, and she feels terribly guilty, and she often says that, I live with this. And it's not her fault. It's nobody's fault. It's definitely not her fault. But this is the problem with guilt, isn't it? That guilt has a way of making you feel guilt anyway, whether it's your fault or not. So, yes, it's really affected her. Yeah.
Do you think that if there had been maybe a protocol in place or something, and the care home had contacted you before you had called them, that your sister might have made it?
Yes, definitely. Yeah.
Thank you. Was your dad able to see your mum before she died?
No. Dad had COVID then as well. So he was in the room next door. He wasn't aware of what had happened. And the carers went into his room, and this was when me and my sister were standing in the care home garden sobbing. There were people walking their dogs around the side, I seem to remember. We couldn't hug each other because that was against the rules, of course. But the carers angled my dad's bed towards us, and they got him to wave. Okay. And we waved back, smiling at him. It was just heartbreaking. It felt just the saddest of times, and we couldn't quite believe what was happening. You know, you look back and you go, did that happen? Yeah.
So even though he was next door and he already had COVID, he wasn't allowed to go to your mother's room or see her outside?
No, he wasn't. No.
Did the care home tell you that this was down to the rules, or was it their procedure, or did they not discuss it?
We asked. We said, if Mum and Dad both have COVID, can they be together? And the nurse said, look, it's very difficult because we're in sort of nursing your mum at this stage. And we said, could you put both beds in the room? And then we were trying everything to get them together. And they said it was just it wasn't possible with the care that they were needing to give to my mum to have my dad there as well. And we did accept that. We kind of saw that would be difficult. Yeah.
Okay. Now, you said you waved at your dad from the garden. Were you able to visit with him at that point?
No, because Dad had COVID, and we weren't able to visit him.
Okay, not even at a distance?
No, it wasn't even, that wasn't allowed. It was just waving to him, and then we had to leave. Yeah.
How did that affect you all? Grieving for your mother at that point?
Yes, it just felt like, gosh, my mum and Dad were married for 62 years, and they were together a lot, especially when they were in the care home. We understood why we couldn't get in at that point, because Dad had COVID and the care home had COVID, so we did understand, as hard as that was, we did understand. We didn't understand quite so much, to put it mildly, when the care home had no COVID in it and our dad was COVID-free. Then we couldn't understand why we couldn't get in. I know we'll come to that, though.
Thank you. I understand from your statement that your sister, you and your sister decided not to tell your dad that your mother had passed.
Yeah.
Can you tell us about your reasons for that?
Well, our reasons were that, firstly, we couldn't be with Dad. So we couldn't tell him that and be there to comfort him. Okay. And the other reason was due to his Alzheimer's, and Dad his memory was going to very seconds. What had happened 15 years previously, his older brother had also suffered from Alzheimer's, and when his wife passed away, their daughters decided to tell him that, which was terrible for him. But then he would forget, and they said that they had to tell him every single day until he too passed away. And that is a tragedy of Alzheimer's. And we didn't want to put our dad through a similar experience. We might have thought differently if we'd been able to get into his room. There might have been a moment. Dad was a very intelligent, bright man, and he would have hated us to have withheld things from him. But we don't know, because we were never allowed in. So we don't know.
Thank you. Was not being able to visit your father having, what kind of impact was that having on you following your mother's death?
Well, it was really hard because Dad recovered from COVID. He was one of the ones in the care home that recovered. He wasn't, even though he recovered, he wasn't allowed to go to the funeral because he wasn't allowed out of the care home. Okay. And although maybe it would have been very confusing having it in the funeral, me and my sister would have liked to be the ones who made that decision. And we might have made that decision at the very last minute if Dad would come along or not, but he couldn't. We did ask around that time if we could get an essential visit because we felt our mum has died in the care home and our dad is in the care home. Surely we should be allowed to get in. This was a bit later when the care home was COVID-free and so was our dad's. I've jumped on a bit. But they said, it was Public Health Scotland said we didn't fit the criteria for essential visits.
Okay, thank you. And you touched on your mother's funeral. Who was allowed to attend that? Well,
at that time, it was just very, very few people. And it just ended up being me and my sister. Okay. Our husbands could have come and our children, but our kids were very young at the time. Okay. And we just thought it would be quite distressing for them to go to a funeral like that and not have the thing afterwards that people do. So do you need the both bits? Yeah. So we thought instead we will just go together and just have the funeral, just the two of us. And then maybe in the future we'll do a kind of end of life, celebrate their lives.
Sure.
Yeah.
Yeah. Now going back to not being able to visit your father, you mentioned in your statement that you made a rummage box for him. Yeah. Could you tell us about that, what it is and what you put in?
I don't know where, I've probably Googled something and I found this thing, and it was just like a little box, and we put things in this box that might have made Dad feel comforted because we weren't able to be with him. We wanted a connection, so things that meant something to our dad. So we put little photos in, we put letters from the grandchildren, they'd all written letters and drawings. We put things like golf balls, my dad was a very good golfer, little cards, little tools, because Dad was good at fixing things. We were trying everything. I think we also included daffodil bulbs and things like that to try and get him to engage his love of outdoors, even though he wasn't allowed to go out. We were trying. Yeah. We were trying to make the best of a terrible situation, really.
And did the staff help with?
Yeah, they did. They did their best. And yeah, at that time actually, because that was a time many people in the care home passed away from COVID, and the staff were having to deal with that. And this was a time when things had eased off a bit, and there wasn't COVID in the care home, and the staff did. And there was a really nice man who was a sort of handyman in the care home, and we sort of sent photos of him, my dad, planting daffodil bulbs indoors. But yeah. So they did their best, and we're grateful to them for that.
Thank you. Now, you've mentioned that your dad wasn't able to attend the funeral, but you mentioned in your statement that you visited him after the funeral.
Oh, yes. After the funeral, me and my sister didn't have anywhere to go. And I just remember on the way home, I just went to the care home for some reason. And I don't know why I did it. I just stood outside the gate, and I just wanted to be near Dad. And one of the carers saw me, and she got Dad dressed up. He didn't have COVID at this time. He got a big coat. She put a mask on him, and she came out to the garden with him, and I was able to see him. And it was really heartbreaking because we had a huge high fence between us and several metres. I'm not sure if it benefited Dad, but I just wanted to see him and be close to him. Yeah. And I'll never forget her kindness, that carer, for doing that. So yeah, she recognised the need for something at that point.
Thank you.
So
yeah, and in excuse me. Apologies, I have a bit of a sore throat, so it's playing up now. You say in paragraph 61 of your statement that you weren't then aware of different approaches being used in other care homes.
No.
And at that point you weren't aware of essential visits.
Yeah, we didn't really know enough about essential visits, but we'd heard this, essential visits, and that's why we did ask. Yeah. But we were told the criteria seemed to be, and this was from Public Health Scotland, that you could only get essential visits if somebody was at end of life. Okay.
When you say this was from Public Health Scotland, was this what North Care were telling you that Public Health Scotland had advised, or did you get that directly
yes,
from?
it was what they had, the care home had told us this, but also my sister had gone and looked at, as she could find what she could in the guidelines, which were changing a lot.
Yeah.
Yeah.
Now, you say at paragraph 62 of your statement that you had no in-person visits from the 13th of March until the 28th, other than the 15th of March when your father was taken to hospital after falling over. And on the 28th of April, the day your mother died, you've already told us you only had an outside visit.
Yes, I mean, if you can class it as a visit, it was our mum died that day and we were standing outside in the garden. Yeah. Yes, so that was the only time. Yeah.
And on the 25th of May, your dad developed a bladder problem.
Yeah.
Is that correct? And the care home nurse called the hospital for your dad to attend to have a catheter inserted.
Yes.
Is that correct? And in your statement, you say that paramedics initially refused to attend.
Yeah.
How did you find out about that refusal?
Well, the nurse in the care home, who was quite strong, she was strong, she told us that. It was a bit of a medical emergency at that point, and she told us that the paramedics had refused to attend. I mean, they were following orders obviously, but and she said to them, this gentleman needs care and he needs to go to hospital, and she said, I'm recording this call.
Okay.
And it seemed to be once she said that they came in and they took Dad to hospital. So he didn't have COVID at the time.
Yes.
So
your dad didn't have COVID at the time, but the paramedics were saying they were instructed not to attend.
Yes.
But when the nurse said she was recording the call, at that point their position seemed to change.
Yes.
And they agreed that they would attend.
Yes.
Once your father was in hospital, I understand the attending doctor telephoned your sister. What did he say to your sister?
He said to her, do you want your dad to be treated?
What did your sister think of being asked that?
She was horrified. Because we weren't allowed to be there with him due to the lockdown rules. So we couldn't properly assess the situation. So, of course, we wanted him to be treated.
Yeah. Could you think of any reason that it might have been better not to treat him?
The only reason I can think of was that our dad was probably very distressed when we went in, but we don't know. Again, if we'd been able to be there, we might have been able to help calm him down. One of the carers was there with him. The carers were allowed to be there, but we weren't allowed to be. But yeah, we said, of course, treat him. Of course, we didn't really know what was wrong at the time.
Yeah. And I understand he was in hospital for a week.
Yes.
Was he again tested before being discharged and transferred back?
He was, and he was negative.
He was negative,
yeah.
Okay. So that was on the 25th of May. Do you recall when you last saw your father before that?
It would have been the day that the day of the funeral, when I saw him through the fence.
Okay.
Yeah.
So, okay. Just shortly after, towards the end of April then, or?
Yeah, it was 13th of May.
The 13th of May, okay. And that's the only time you'd seen him since your mother passed away?
Yes, yes.
Okay, thank you. And you say in your statement that the next time you saw him after the admission to hospital was the 6th of July. That's almost a month and a half after hospital admission.
Yes.
Given your father's Alzheimer's, do you know how he was affected by not being able to see you or your sister?
I mean, our dad, we're a very close family and we would visit the care home a lot. And our dad's Alzheimer's, which we think was probably made a bit worse from COVID. We don't know if it was COVID or it was his isolation and mum not being there, but his Alzheimer's did definitely get worse. It took a dip. So it must have been awful for him. That's all I can say. It must have been awful without us there with him.
Thank you. After the 6th of July, how often were you able to visit?
We were able to visit once a week.
Okay. And how long did the visits last?
I think they were about half an hour.
Okay. And where did they take place?
Well, at first, it was in the doorway of the care home. So it was, the care home had to declare itself COVID-free to have the visits, and Dad was COVID-free. And there was I remember we went to the care home, and there was a giant table. I don't think I've ever seen a table so big in a doorway. It was huge, and it was definitely designed so people couldn't get past it.
Okay.
I think the worry was, what we took it as, the worry was people would try and hug their person. But there's no way you could do that. And it was very clinical. It was, hand sanitizer and a sort of plastic thing with instructions about what we had to do to sign in, and masks, obviously. Yeah.
And you say in your statement that the care home told you that Scottish Government restrictions meant that visits had to take place in the doorway of the care home.
Yeah, the doorway or outdoors. Yes.
Okay.
I mean, it was outdoors. We were outdoors.
Yeah.
Our dad was in the doorway. Yeah.
And did staff always adhere to protective measures with PPE and so on?
They were all wearing surgical masks. We felt the masks were kind of ineffective, actually. We'd done lots of research into masks, and we always wore FFP2 masks, which we bought ourselves. And there were these sort of surgical ones, the blue masks, and sometimes people would be wearing them, they would slip, wearing them under their chin, and they were propping them back up. Okay. There was a bit of that, not all the time. We saw this a few times, though.
Yeah.
Yeah.
And you mentioned in your statement that sometimes they wore them just below their nose.
Yes.
Did you raise concerns about that?
We did, absolutely we did. Raise concerns with the owner, and she took it seriously. Okay. But they just didn't seem to fit. Okay. Our FFP2 masks fitted us. They were a snug fit.
Yes.
And we were, why aren't they giving them, why don't they get them to wear? The European standard, that's what they wear, the FFP2, the R ones. So.
Thank you. Did you have any privacy when you were visiting?
No, there was no privacy. There was obviously nobody in the care home. There was just the girl who was the administrator was there. But actually, when you say privacy, she left us. She did leave us on our own. I think she trusted me and my sister, and so in that way there was. But it was quite. The first visit was not very nice because it was very tightly timed. And Dad was quite distressed. I think sometimes with Alzheimer's, people's spatial awareness can be affected, and he kept saying, "What's this under the table?" And it was the space under the table. And there was, he said to us, and this is really hard, he said to us, "Have I done something wrong?" And we were going, no, Dad, you've done nothing wrong. We tried to explain about the virus again. And it was only recently that my sister said to me, "You know what, I think Dad maybe thought that he was in prison." Because it felt like a prison visit. There was nothing nice about that visit. There was nothing there to make it pleasant. There was no flowers. Maybe they weren't allowed. I don't know, but it felt very clinical, and it distressed him.
Because you mentioned in your statement being aware of other care homes having bunting and flowers.
Yes, I think this was maybe a little bit later on, to be honest. They had, other care homes had gazebos out with bunting, and it was all outside. Our care home wanted to keep the garden free for the residents. At one point they were talking about having a porta cabin in the car park of the care home with a perspex thing dividing me and my dad, and we were thinking, what horrendous thing to do, how to make it even more like a prison. Thankfully they didn't do that, and the care home owner eventually relented to me and my sister. We told her that our dad was distressed by these visits in the doorway, and she let us come into the garden, and Dad would be sitting on his little patio, and we would be sitting in the garden with him 2 meters away with full PPE on. But it was better than the doorway.
And I understand that you contacted the MSP for the area of the care home, and you subsequently met with him on Skype.
Yes.
Can you tell us about that conversation and what came about?
Yes, I think, just look at the notes actually. The MSP, that it was in the constituency of the care home, just sent him a very long letter telling them what had happened, and just expressing my concerns and fears about the impact the pandemic was having on my dad. And I stated in the letter that I would like to see families of care home residents with special circumstances, such as my dad, to be given the same testing rights as key workers. And if that was the case, we would be able to visit my dad in his room, wearing PPE, being tested, and be more able to supply the comfort and stability that he desperately needed. So that's what I asked.
Yeah. And was he able to help?
Not at all. No.
So nothing changed following that?
Nothing changed, no.
Okay. Now, you mention in your statement that you were generally allowed what were called garden visits, although they were at the doorway of the care home. But you weren't allowed to visit on your dad's 86th birthday, which was his last birthday, is that correct? And you say that you couldn't visit because it was a Sunday. Why did the day of the week affect whether or not you could visit?
We were just told, the care staff can't facilitate a visit at this time. And it was, we challenged it, but we were getting desperate, me and my sister at that time. We were getting utterly desperate. So we just had to go with it. So we sent him in presents and cards. I don't know if this would have meant much to my dad, but it meant a lot to us. And they had to be kept aside for something like 72 hours, so we had to put them in before. And one of the carers said that she opened the presents with our dad. But we always were with our family for birthdays and Christmases. And I think it felt like it was another meaningful moment that was denied.
Thank you. What impact did that have on your extended family, your children, your sister?
I think we were so beaten down by then, you know that? We were so beaten down. We sort of accepted it. And I think we got our kids as well to write cards and everything. But we were exhausted and really sad because it was our dad's last birthday.
Yeah. Now, I understand that your father died in December, and about 2 weeks before he died, you were finally given essential visitor status. How did that come about? Did you ask for that?
Yes. Well, what happened is that we had a few visits with our dad in the garden as we were allowed to, and we noticed that he was sleeping an awful lot, which was unusual. And we raised this with the care home, he's sleeping, and they said, oh, he has had a bit of a cold and maybe he's a bit tired. And then there was one day that my sister was in and she phoned me and she went, no, this isn't right, it's not right. He's sleeping through the whole visit and it just doesn't feel right. And she got in touch with the care home and said, we need to get a GP in to see Dad. And let me just make sure that I'm getting this completely correct. Yes. The GP advised at that time that essential visits would be appropriate. And we were let into the care home on the 11th of December. However, the GP didn't actually go in until the 15th of December. But I think because the GP had said to the care home, I think you should give essential visits, that seemed to have a bit more gravitas than us seeing it. So the care home manager and the care home owner accepted that. When the GP did go in, my sister was on a visit then, and he didn't examine my dad. He stood 2 metres away. And we were thinking this is maybe an end-of-life situation, but it was all very confusing, actually, at the time.
Okay. So even though a GP was able to attend at that point, your sister's impression was that he wasn't getting adequate medical care because the doctor wasn't actually examining him?
He was just looking at him, yes.
Okay. You say that you wanted to take your parents' dog to the care home, but again you were told that public health wouldn't allow that. Yeah,
their little whippet Bobby, they loved their little dog, and I took the dog when they went to the care home, and we took him in all the time to visit. I realise I've mentioned the dog's name, that's okay.
Yes, I think that's okay.
Sorry. Right, so yes, the whippet would go in a lot to to visit. And I think even at the outdoor visits, I remember my sister would run over him with a wipe, sanitizer wipe. But then we were told that pets weren't allowed. And that had a real impact on my dad, because he loved his dog and it gave him comfort and familiarity again.
So you think that would have made a difference for him?
Definitely made a difference, yes.
Again, you were told that it was Public Health Scotland.
Yeah.
And you say in your statement you didn't have any contact details, telephone number or email address for Public Health Scotland, so you weren't able to verify or challenge these rules?
It was really difficult. My sister tried to find how do I contact them. There seemed to be no email address, there was no phone number. For the thing with the dog, we did ask the care home to provide us with the guidelines, and the care home owner did.
Okay.
And we could see very clearly pets weren't to go in. Yes.
Would you have liked to have had a point of contact at Public Health Scotland?
Yes.
Would that have made much of a difference to you?
It would have, because we would have challenged a lot of the things that they were saying. Yeah.
And I suppose when you received the letter from the Scottish Government, given the terms of that, had you been able to contact Public Health Scotland, you could have perhaps gotten to the bottom of these conflicts. Now, okay, you say in your statement that your dad could possibly have been classed as end of life in July 2020. Why is that?
It's just from what I know now, actually, that people can be at an end-of-life stage for quite a long time, sometimes up to a year, I've heard.
Yeah.
And I look back now and I think, yeah, Dad probably was end-of-life. But there was no GPs going into the care home to assess this. And I don't think a nurse can, so I don't know. Yeah, it's hard to say, but I think he could have been classed as this.
And were your children ever able to visit their grandfather?
No.
Not even at the end of life?
No. It was only me and my sister.
Yeah. What impact did that have on them?
Well, I think like children are, I think, you know, our husbands probably protected them quite a lot from it. And they were, you know what kids are like, they've got their own issues. They were doing their homeschooling, and we were trying to keep them close to their grandparents and showing them photos and explaining what was going on without too much detail. I think our children were quite worried about me and my sister as well, you know, so.
Thank you. Now, I want to turn to the impact of the restrictions. Could you
How long are you going to be, Ms. Brima? I'm conscious of the fact that the stenographer has now been at it an hour and 25 minutes.
Oh, thank you, Lord. Perhaps another 5 or 10 minutes, my Lord.
Well, if you're sure you can do it, well.
I don't think it would take longer than 10 minutes, but it might take longer than 5.
All right, but I can't let you go beyond 10 minutes because by then the stenographer will be, they're meant to get a break every hour and 10 or 15 minutes.
Thank you, my Lord. Could you read paragraph 74 of your statement, please?
Yeah. The impact of these restrictions was huge. We did not see ourselves as merely visitors to our parents. We were an integral part of their care team. We oversaw everything. Care homes are not perfect places. Every little thing that was wrong, my sister and I sorted. People with dementia lose their voice, and we were their voice. So not being able to get in when my mum died or afterwards to comfort my dad really angered us. The anger I felt was off the scale. The reason for this anger was that by this time society had opened up, but care homes were not allowed due to rules from Public Health Scotland.
Thank you. And could you read paragraph 75 as well, please?
In July, August 2020, when society was opening back up, restrictions were still being imposed on us and our dad. Dad was never allowed out again for a walk in the fresh air. We wanted to take him out in his wheelchair for a walk by the canal to hear the birds singing. Even though we said that we would wear masks and gloves, this was not permitted. Meanwhile, Eat Out to Help Out was happening. I believe that care home residents received the worst of both worlds. They weren't protected in the early days of the virus, and then were pretty much imprisoned once the Scottish Government realised their mistakes and the number of deaths their decisions had caused. My dad was like a prisoner in the care home.
Thank you. Now, sorry, just a moment. I'm going
okay.
Thank you. Okay. Now, your father sadly died on Christmas Day.
Yeah.
And he was given end-of-life medication on that day.
Yeah.
Was he reviewed by a doctor before being given that medication?
Yes. I think the day that the GP went in and kind of assessed him, there was end-of-life medication made available at that time, if the care home needed it.
So the decision was made at that point?
Yes.
Okay. And there was no discussion about taking him to the hospital?
No.
Okay.
And actually, we didn't ask at that time because we just felt this probably is end of life. Our dad doesn't have COVID. He seemed comfortable.
Yeah.
Because we were allowed in, we could assess the situation and we could see what was happening. And we thought this is time for Dad to be able to pass away peacefully with us by his side.
Okay. And were you able to hold his hand?
Yeah, we
comfort
did.
him?
But we were wearing gloves.
Okay.
And I wish I'd broken the rules and taken my gloves off at some point, but I didn't. And I regret that.
Thank you. Now, you in your statement, you talk about lessons you believe should be learned, and we have all those, and we will consider them. I just want to touch on a couple in particular, and I wonder whether you could please read paragraphs 110 and 111 of your statement.
Sure. What could definitely have been done better was my mum getting access to hospital when she was suffering badly from the effects of COVID-19. She should have been given oxygen and a fluid drip instead of being denied these basics. If this had happened, she may have survived. In any future pandemics, I believe that better healthcare treatments should be made available in care homes. NHS nursing teams should be brought in to administer oxygen and fluids. Public Health Scotland should have been able to mobilise NHS nursing teams to go into care homes in such circumstances. When it was safe to do so, for example, when a care home was declared COVID-free, they should have let family members in. They should obviously have been tested and wearing PPE, but families are so important. Families are not merely visitors, but an integral part of the care team. Even just one designated person, that's all we were asking for. Family members could have provided much-needed comfort, and they could have helped their loved one to eat better, mobilised, take medication, etc. The staff in care homes during COVID were run off their feet, many of them traumatised, having cared for people who died without their loved ones by their side. Families should have been allowed in to help. This is why Anne's Law needs to be implemented by the Scottish Government as soon as possible, so that the right to visit a loved one in a care home during a pandemic is enshrined in law. I think care homes were very nervous about letting families in. They were incredibly worried about further COVID outbreaks and didn't want to shoulder the blame. This is understandable. The Scottish Government could have supported the care homes by putting visiting rights in law rather than merely guidance.
Thank you very much. Do you think that you've been heard on everything that's important today?
Yeah, I think I have.
Okay.
Yeah.
Thank you very much. I don't have any further questions.
Okay, thank you.
Thank you very much indeed, Mrs. Duncan. I'm very grateful. Thank you.
Thank
We'll
you.
take a break now until just before past.
Thank you. Apologies, my Lord. If I may just remind those in attendance in the hearing room that the witness's sister's name was referenced. It is subject to a restriction order and so should not be repeated.
Thank you,
my
Ms.
Lord.
Now, good afternoon again.
Lord, I should say the next witness is Catherine Russell.
Yeah.
Witness statement reference is SCIWT 0366 and then 501.
Thank you. Good afternoon, Ms. Russell. Right. Now, when you're ready, Mr. Gill.
Thank you, my lord. Hello, Mrs. Russell. Your full name is Catherine Russell, is that right?
That's right.
You're known as Kathy, I think, but I think to your family you're known as Rena.
That's right.
Your personal details and contact details are known to the inquiry, but you're now retired. You provided the inquiry with a statement, and you are agreeable that it can be published and that your evidence is recorded.
That's right.
And I think it's apparent from reading your statement that you are able to be very precise about certain dates, and obviously something that you kept records of during the pandemic.
Yes, unfortunately I didn't keep a diary during the pandemic, but I did write quite a lot of emails and I have those.
Yeah. Your statement is detailed and lengthy. That's not a criticism. It extends to 35 pages over 200 paragraphs. So you'll forgive me if I concentrate on certain aspects of it. But can I assure you that everything that you've said in the statement has been and will continue to be considered by the inquiry. Now, you gave evidence a few weeks ago as part of the core group of the Care Home Relatives Scotland group, and you do make reference to the establishment of that group at paragraphs 108 and following, and also at paragraphs 170 to 184 of your statement. Now, I'm going to ask to take what we see there largely as read, because I think a lot of it we have already heard before from you. But there are just two matters I'd like to refer to within those sections. Could we first of all go, please, to paragraph 113? And I think you set out there a statement that you published. I think that's referable to the date in the previous paragraph, which is the 12th of October 2020. And you set out that statement that you published. And I think that was something that you brought to the attention of other members of the group. Is that right?
That's right. We always agreed after we had meetings with the Scottish Government, we agreed a kind of briefing for the group that we would publish that day, because people were desperate to know of any news.
Can you just read what you say, please,
I said,
at 113 down to 116, please?
I published a statement that day to the group saying, "It's taken me a while to get my head round all this. It's a small step in the right direction and could help people in care homes in some areas. The designated visitor or their replacement can stay longer in the resident's own room. The value of touch is recognised, and touch is allowed with PPE. People outside the Central Belt might benefit from outdoor visits where you can bring children or the family dog. It goes on to say, but there are now, however, local restrictions across the whole of the Central Belt, but care home restrictions only apply to Glasgow, East and West Dunbartonshire, East Renfrewshire, Renfrewshire and North and South Lanarkshire, and not the rest of the area. Although it was Greater Glasgow and Clyde, it excluded Inverclyde. I said, improvements on how essential visitors are defined are really welcome and should enable families to benefit from essential visits. They had increased the reasons for essential visits. It wasn't only for end of life, it could also be for distress and things like that. The guidance falls short of giving essential caregiver status with training and PPE and testing, and I was disappointed that the guidance provides the designated visitor 1 visit per week for up to 4 hours, when I had clearly understood from the meeting that we could visit more often and for longer. These were the words Jean Freeman had used.
So this was in the context of following upon a meeting with Jean Freeman, who was the health minister.
That's right. We'd had the meeting with Jean Freeman, and then, but the guidance wasn't published on that day,
no.
So we had to wait for several more days for the guidance to actually come out. But as I say, by the time we saw that guidance, I knew right away it wasn't going to help me or anyone in Glasgow or Greater Glasgow or Lanarkshire.
Okay. And if you can just finish off with 116, please.
I said, against a tide of rising cases, it's good we've made some progress. I said that because I was trying to keep it positive and not be down on everything all the time. I firmly believe that had we not formed our campaign in August and gone to the Scottish Parliament last month, visiting may have stopped altogether by now, but our campaign continues, but we have a very long way to go.
Okay, that was something you were saying in October 2020, so 6 months into the pandemic.
That's right.
Yeah. Could you go please now to paragraph 181 and 182 of your statement? And again, this is in the context of your comments regarding Care Home Relative Scotland and establishing that. And I'd just like to, so we've got this, these comments from you. Could you just read 181 and 182, please?
We can't complain about how much time the government gave us. They were very willing to engage with us and still are. Jean Freeman even gave me her phone number so I could text with anything urgent, and she had mine, and this was helpful on a number of occasions. For example, a member of the group had let me know that a gentleman in a care home in Ayrshire had committed suicide because he was so upset. This was because he was a gentleman who normally went out walking along the promenade every day, and he had been locked up by that time for more than 6 months. And and I let her know that had happened, and I passed that information on to her. However, we were extremely frustrated that while the First Minister laid down the law for pubs, for hospitality and every other kind of business, they argued they couldn't force care homes to do anything. We felt that was just not the case. The care homes, in fact, were crying out for clear, simple rules on an A4 sheet, and managers needed to be told, if you follow these rules, you have our complete support. Instead, all the guidance was written with an underlying threat to the managers, which Operation Copper didn't help.
Thank you. And that final comment, those final comments in 182, did that remain your position for really the bulk of the pandemic?
Yes, I would say that things improved from March 21. When they brought in Open with Care. There was, at that stage, there was definitely a shift of gear and much more care homes were coaxed a lot more and advised a lot more to start re-establishing visiting. But of course, by that time, they'd all been vaccinated and the residents had all been vaccinated. And it's my view that we might never have got to see her. I would never have seen my mum again if that hadn't happened, because I think that was the only way I was ever going to get in.
Thank you. Now, you're here to tell us about your mother, Rose Hamilton, and she died on the 20th of July 2021.
That's right.
And she was 89 when she died. And latterly, she was a resident at Clarence Court Care Home in Glasgow, where she'd been since late October 2019, I think.
That's right.
Just to get a little flavour of your mother, I think you tell us at paragraph 3 that she was a mother, a grandmother, and a great-grandmother.
Yes, she was.
And to her, really, her family was everything.
That's right.
Yeah. She was widowed when your father died in 1994, I think. And thereafter, your bond with her became very strong, or even stronger.
Yes, I think, I mean, we were always close, but I think at that stage, I mean, my mum was just devastated when my dad died. I mean, that was just never in the script that such a thing would happen. You know,
he was only in his 60s.
She was 63, and she was still looking after her own mother, who was 98. And it was just such a shock when my dad he ends up in a bowling final and keeled over with a massive cerebral hemorrhage. So I think at that stage, obviously, you become a lot more, you know, there's in a way an emotional dependence or codependence, you know, developed at that stage.
Again, just getting a little flavour of your mother in her later years, particularly. I think she was a keen walker, which is something that she shared with you and your husband.
That's right. We got her into walking. We knew she liked the countryside, but she'd never actually... She'd always just ran about looking after us all, and my dad and my granny. But it was when my dad died, we said, well, the one thing you could go and do is start joining walking groups. And I took her away with... We were in a hill walking group, but we also took her... I took her to the CHA and the Glasgow Health Culture, because my mum didn't drive. And these were walking groups which operated in public transport. You just went along to Central Station and seen the woolly hats and joined the group. And that gave her an outlet for the next 20 years. She was actually up Monroe's with me on her 80 when she was 80. So she was a very fit lady for a long time.
I think also her faith was very important to her. She was a regular attender at the Divine Mercy group in Glasgow.
Yes, I think especially after my dad died, it tends to pass from one relative to the next. My dad was holy, and then when my dad died, my mum took up the... you know, she went to the Divine Mercy, and they were very, very kind to her there. I think she'd got a lot of solace from that.
And I think we know from paragraph 146, and it's not necessary for you to look at this, but your mother did receive the last rites before she died.
Yes.
And I think she acknowledged that by, as you put it in your statement, giving your sister, quote, a big smile and a thumbs up.
Yeah, she was delighted, very aware that that was a box ticked.
And she retired when she was 65 in 1996. And from what you say, I think she had generally very good health.
Yeah, she had great health, and she spent Monday to Wednesday every week through here in Edinburgh, where she was Granny Rose to my sister's children. And then she, at the weekends, she would go out with her walking club, and she had her own mother for another 5 years after my dad died. She lived till she was just short of 103.
I think she did develop osteoporosis, and I think she made a fairly pointed comment to you about that.
She was very indignant about that. She was annoyed that we hadn't noticed she was shrinking, and but she was so devastated when my dad died. I think she just curled up, and I just took it to be that. But she had actually developed osteoporosis. But she did actually improve her bone density by taking all the calcium and everything.
And I think you also say that she was very sociable. She was a very sociable woman.
Yes, she loved company. She loved a sing-song. She was always visiting people and making fruitcakes and delivering them round neighbours and things.
Now, so far as her health was concerned, I think, and this came about because of individual, and please don't name them, within your family who have medical qualifications, there was a concern that she might have Parkinson's, and that was, I think, dismissed. But around the same time, there was a concern that she might have age-related cognitive decline, which I think you had noticed.
Looking back on it, my mum probably did have some form of dementia. I think it was probably vascular. She had many. It seems subsequently after a brain scan, they never said to me, "Mum, your mother has dementia." They just said her brain's full of holes, and I think that means vascular, probably. You know, there's just a bit of damage there.
And I think you were probably about to say that she did have a history of having some mini strokes or TIAs, I think. Probably.
We were unaware of that. We'd never seen anything like that, but when she had the brain scans, they said there was evidence of damage. And that was in the basal ganglia area, which is the same area as is affected by Parkinson's, which probably explains why she showed some of those traits.
Yeah. You and your sister had a power of attorney put in place regarding your mother, regarding welfare and financial matters.
That's right.
And as I understand it, she was at home and you were involved in her care.
That's right. I had retired in 2013, and we'd kind of developed a nice sort of programme for Mum, whereby I was going up to Aberdeen on a Monday and Tuesday to look after grandchildren, and my mum would be in Edinburgh then, because my sister would maybe take her through there on the Sunday night or the Monday, and then I would go back and collect her from Edinburgh on a Wednesday, and I would take her out with her friend for a run. You know, we went lots of day trips and everything.
Yep. And in May 2018, you yourself had a serious accident, I think.
Yes,
and
right.
It was really at that time that you realised that it was going to be difficult to meet your mother's care needs. Is that right?
Yeah, I was in a lot of pain with quite a bad accident, and so at that time I did hire a neighbour to help out with Mum.
Right. And I think you also say that she had a number of falls.
Yeah, I mean, I know more about these things now, and I know that is all related to, to dementia, that people's balance goes, and her balance was poor. She did have quite a lot of falls.
And at paragraph 20 of your statement, you say that following another fall, she was admitted to hospital in October 2018, where she remained for a number of weeks. And after her discharge, you arranged for care at home.
Yeah, if she had an assessment and she got a very good care package to come out of hospital, but it was withdrawn within 2 weeks. And she just was getting, 1 or 2 visits, and not always from the same person. So I kind of built that up myself by hiring another carer, and as well as the lady that we already had.
I think as time went on, you became concerned that your mother was not eating. Yeah,
she always ate well when I was with her, but I was finding meals in ovens and in the microwave. Food didn't disappear from the fridge, But she said, "I'm an old woman, I don't need much food. I don't need all that feeding." I suppose you expect them to eat the same as you do, but I think she just forgot the food was there.
Yeah. And in July 2020, she suffered, I think, a serious back injury, which again involved her in having a period in hospital.
Yeah, she broke her back in 2 places in a fall in her kitchen. we were out and we got a call from the telecare service, because by that time my mum had telecare, which is the alarm system, and if they fall, they can try and speak to the person, and they hadn't been able to speak to her, but they said, we think she's on the floor. So my husband and I just jumped a taxi and went up, and we couldn't move her. I mean, she was very light, but she was in so much pain that we couldn't move her, and we had to wait for an ambulance, which didn't take all that long, actually, and she was taken to the QE.
And I think after that, that was in fact the last day that she was in her own home.
Yeah, sadly, she never got back home after that.
And you also indicate that you were very determined, or had been very determined, that she should not go into a care home. But the point was reached where you felt she was too vulnerable to be left alone.
Yeah, I think we reached that stage where we really had to decide whether or not, I think the only way we could have kept her at home would be to move in and deal with all the carers coming and going. We couldn't have left her on her own overnight or anything, because she couldn't make a call, and she couldn't use a phone anymore. She was just very vulnerable. And she also didn't like the key safe. She was frightened when people came in using the key safe. She didn't know who was coming into her house, and I think she found that very frightening.
Now, you looked at a number of care homes and settled on Clarence Court Care Home. And after a further period of hospitalisation, she moved in there. And you tell us about that in paragraphs 36 onwards. And again, just taking it short, you were able to personalise her room.
Yes, my mum had been taken to an intermediate unit, an intermediate care unit, but she got a very bad infection there and was moved back to hospital. I thought that was the end, actually. I didn't think she was going to survive that, because she was really, really ill. But she rallied round eventually, and we got her back. But during that period, because I already had the care home place for her, we went in and got it. No pictures put up and everything. Had the room nice for her coming out.
In paragraph 40, you say it was a very difficult decision for you to make regarding your mother going into a care home. But effectively, she needed 24/7 care. She
did. And even during the pandemic itself, when I was really distressed and saying to the care home, I want to bring her out, they said, you couldn't manage your mum. There's no way you would cope.
Yeah. And I think you summarised things at paragraph 41. I'm sorry, paragraph 51 of your statement. And perhaps you just read that, please.
At 51, I just said, I know that a lot went wrong during COVID with people being transferred from hospital to care homes, but this was before the pandemic, and I'd made the decision that that was the best way forward. I'd found a care home that I felt would be good and that had her room nicely ready for her and put all her familiar things in it, her pictures up, and I bought a new TV and put it in, and I just wanted to get her moved over from the Langlands, which I didn't think was a great place.
Right. Prior to the pandemic, you say that visiting your mother in the months between November 2019 and March 2020 went well. I think that's in paragraph 56. Yeah,
I mean, over the last 3 years, obviously I've been in a bit of a learning curve about care and all that, and I have real reservations about care homes and the whole setup and our over-dependence in private homes. But I have to say that first few months of my mum in that home went really well, and it was we were all able to visit, all our grandchildren all came. We were able to get assistance. I couldn't get my mum in a car because she couldn't stand or transfer. So but I could take her out in a wheelchair and get an assistance taxi and bring her up to my flat, which has a lift. And so we all, my brother came up from down south, and we all went out for our birthday on the 23rd of November that year. So we had to a local restaurant and everything, because Clarence Court's in quite a busy wee area with lots of cafes and things. So it was just quite sociable being there, and it was very close to my house.
Paragraph 58, you say you had a contract with the home regarding visitation. Was that a formal contract? Did you have with
you have to, because you have to pay for care homes. So, so you sign a contract, and the contract.
And what did it provide in relation to visiting your mother?
It said that visiting was unlimited.
And did you exercise that?
Yes, well, it was a busy time because obviously my mum was only in there. She was in November and December, and I had hoped, I thought we'll give it 3 months, and then see how if there's any chance of getting mum home, because I still hoped that she might recover enough that we could have got her back home. But unfortunately, there was, we could see that she was still very, very frail, and I had to kind of then think, well, we had better try and get our house on the market in case it takes a wee while to sell. I didn't want to run out of money. So we put our house in the market at the beginning of February, but it actually did go very quickly. So that was.
And I think one of the things that did continue, at least, was your delivery of toasted cheese to your mother.
Yeah, well, that kept. My mum liked toasted cheese, but that happened, to be honest, even during the pandemic. I know from the group that an awful lot of care homes where people were handing stuff in, and it all had to go into solitary confinement, like the residents. It all had to be quarantined and everything. But my mum's care home were quite good about that sort of thing. I used to take her. I had taken her toasted cheese on a Sunday. I would go in a Sunday morning with that, and she always liked it. So I kept that up after the pandemic, and handed that in, and they would send me a wee email to say she'd really enjoyed it.
Okay. That apparently didn't need to be cleansed before she ate it.
No, I think, hallelujah, there was somebody with common sense that could see that this was not any different from someone getting toasted cheese from any source.
Now, paragraph 63 of your statement, you deal with the start of the pandemic and the contact that you had with your mother between March 2020 through to July 2021. And you mentioned that, as I say, members of your family, extended family, and again, please don't name them, but were in the medical profession, and they were aware of Home Office briefings that had been made about the emergence of the virus, particularly, first of all, in China and then in Europe.
Right.
And I think you agreed at that time that you agreed this with your sister, that if the position came to be that only one person would be allowed to visit your mother, then that person would be you.
That's right, because I was the only one in Glasgow. My sister lives in Edinburgh, and my brother's down south.
Yeah. And on the 16th of March 2020, the care home contacted you and said that it was proposing one essential visitor, and that they were reviewing their Skype and FaceTime arrangements.
That's right.
And you informed the care home that you would be the one essential visitor, and that at that time you were generally supportive of the restrictions and precautions that the care home were putting in place.
That's right. In fact, before the care home emailed us at all about it, I had been in touch with them and said I thought they should maybe reconsider whether or not the nursery school and so on should come in, because they had a link with a local nursery. just given the levels, the levels of infection might be starting to build up. So, I mean, it's something that's quite important about our group is that we've never, I don't think any of us have ever thought COVID wasn't dangerous, but we just believe that we weren't visitors.
Yeah. Well, we'll come to that in a moment. I know you express it very forcefully later. Just on the practicalities, was your mother able to use FaceTime and Skype?
Well, they had a visiting coordinator in the home, and not a visiting coordinator, they had an activities coordinator, and it became his job to go around residents with and arrange their Skype calls. And my mum got 4 Skype calls a week. I subsequently realised that was extremely generous compared to what most people were getting. But my daughter, a niece, and my brother and sister all had Skype calls every week. And my brother used to play guitar to her because my brother said to me, I don't know what to say to Mum in a Skype call. And I said, well, just sing to her, just play the guitar. And he got quite good at it. He was starting to rehearse and everything. And he could hear other residents singing along with him.
And did your mother get benefit from those Skype calls and other FaceTime calls?
I think we were fortunate. I think most people with dementia and other conditions, an awful lot of people in care homes couldn't benefit from online. But my mum's life became quite virtual, and in fact, I used to do window visits just after a niece had a Skype call with Mum. And my mum would be sitting looking at this screen, and then she would turn to me and she'd say, where's my granddaughter gone? She couldn't actually tell the difference in some ways. But I think there's a big difference between physically seeing someone yourself and seeing them on a Skype call. You could see whether or not, I was able to tell the home, I think my mum's got a UTI, and I could tell that through a window by looking at her. I just knew.
Right, just moving on, in March 2020, I think it was St. Patrick's Day, you had a meeting in your mother's room, but it was that night that you were told that all visits were being stopped.
That's right.
And at paragraph 70, you describe your reaction as being devastated. And I think it's important that we just go on from there, because you subsequently wrote to the care home. I think the prompt of that was Mother's Day, which was upcoming. And you particularly made the point that you could not be kept away from your mother for 18 months. And you make reference to Professor Neil Ferguson's paper. Can you just explain what you took from that?
Well, it was very clear from Neil Ferguson's paper on the pandemic that it was going to be a very serious situation for 12 to 18 months. And I couldn't really see, I just felt I'm being locked out here and I can't see any way back in. There doesn't seem to be any game plan. It's just like we're locking you out and we haven't sorted out how we might ever get you back in again.
How did you become aware of Professor Ferguson's paper?
Well, you're just online all the time. I was up all night. I was up all night howling, and I was just online all the time, reading everything I could about the virus. And that paper was readily available, and I was also reading about a care home in Spain. By the 20th of March, the BBC had published a story about a care home in Spain where the residents had been abandoned, where everyone had ran away and left them all dead in their beds. And I had been working in Strathclyde and in South Lanarkshire doing a lot of social work PR all my life, and I know there's nothing more dangerous than a locked institution. And I just think to keep people's loved ones away from them like that they were creating an extremely dangerous situation.
Having written to the care home on the 20th of March, as you say in paragraph 71. Did you get a reply?
Sorry, which one's that?
Right. You wrote, paragraph 71 of your statement, you wrote to the care home in relation to your Mother's Day presents, and you'd make reference to Professor Ferguson's paper. Just wondering, did you get a response to that? Do you remember?
I don't think so. I mean, they would generally reply about, yeah, that's fine, about the flowers or things, but mainly it was an admin. It was the admin that replied. Mm-hmm. So, you know, it was more just on practicalities, really.
Yeah. So there wasn't anything in response to you which addressed your concern that you might be kept out of your mother's presence for up to 18 months? Yeah,
and I did stress in that letter that I considered myself an essential visitor and that I had power of attorney, and I had been looking after my mother for years. I was her main carer.
Yeah. You tell us about window visits, which were both closed and then open. And at paragraph 77, you say something about your mother's reaction to those window visits. I think this is something we've heard on a number of occasions. Perhaps you would just explain what was her reaction.
Yeah, well, my mum kept asking me, the window visits at my mum's were that she was wheeled into a dining room which had patio doors, which were kind of wooden and they weren't kind of like big open door, big all glass. They were more like panels, and she kept saying, "Open that door, open that door." Well, I couldn't open the door; it was locked. But what I did was I would phone in, and the staff would bring a telephone and speaker and sit it away from my mum, because if they gave her the phone, she would push buttons and cut me off, and I would have to ring in again. And so they would sit the phone out of her reach, but she kept asking me to open the doors. And I said, "The doors are locked, Mum." And she said, "Am I a prisoner here?"
Yeah. At that point in time, and I appreciate it may be difficult for you to make an estimate about this, what do you feel that your mother's cognitive abilities were? Do you think she understood what the position was?
She understood quite a lot about it. I told her, she really laughed when I told her that my grandson, who was 3,
Good. Thank you.
Yeah. And just before we continue on, Mrs. Russell, can I remind you, and I appreciate how difficult it is, can you try to avoid naming even members of your close family? And can I also remind everybody that the restriction order does apply in relation to that one mention. Right, can we go back to paragraphs 78 and 80, please, between 78 and 80 of your statement, because I think you reflect there what you saw as the unfairness of the situation where others were allowed to have access to your mother, obviously care home staff, but other people who could have access to your mother, and you weren't. And I think, can I just ask you to read the last sentence of paragraph 80, just so that we can get your full picture on that?
Yeah, I'm just saying that the last sentence is that the carers were delivering a great standard of care, but I didn't see that I would have greatly added to that risk, added to the risk.
Yeah. And I presume that in those situations you would have taken the appropriate level of precaution and infection control.
I mean, that's the only thing I thought at the very start. Well, there was a lot in the news about shortages of PPE, although I had asked the home if they were short of PPE, and they said they weren't, that they had plenty. But I could understand that if they were to start giving that to relatives as well, at that stage, it might have created a problem. So I could understand it right at the beginning, but I really felt that with the same measures as staff were using, then I could have been able to see my mother, because I didn't think I was a visitor. I very much identified as one of her carers and her daughter.
You've told us that in this period you were staying up at night searching for advice, information, and I think also in this period you became a regular corresponder with various individuals, and you summarised some of this at paragraphs 81 and following, and again, just at this stage, can I ask you not to name. But at paragraph 85, you say that, well, perhaps you just read paragraph 85, please.
I said I couldn't believe this was happening. Well, I could, as I had a premonition I'd be locked out for a year. I couldn't see what the game plan was. If the game plan was that they were stocking up on PPE, well, that was already happening. If they told me that until they could get me PPE and training, in infection control, you can't get in, I would have understood. But it was so obvious, if they had any plan at all, it was to do nothing to reunite people and to wait in a vaccine.
Yeah, now that may be an inference you had drawn. Can you just explain why you had come to that view?
I couldn't see what else was going to do it, because I had been saying to people, look, I will wear a moon suit, whatever I need to do to get in there, I will do it. And yet I still wasn't getting in. So I had to conclude that I was going to have to wait for a vaccine. And, at that stage, we had no idea how long that would take.
Right. Now, paragraphs 89 and following, and I think this is something we can safely refer to, the name. You sent a letter to Gregor Smith, who I think was the Chief Medical Officer.
That's right.
Yeah. And you say that you were, in your opinion, quite cheeky in that letter.
You could see my letters were becoming growingly, they were becoming more and more irate. and irrational, actually, in some cases. But, you know, you could see that I was starting to lose it because I was just so desperate.
And can you just summarise what you were actually saying to Professor Smith at that time?
Yeah, well, I referenced that it had been 3 months since I got to spend time with my mother, who was in a care home where there had never been a COVID case, and that phase 1 out of lockdown indicated that a designated visitor system would be introduced. That hasn't happened. Phase 2 spoke of wider visiting. That's clearly not going to happen either. Now the home have sent me a letter with your name on it, telling me I can't see her till the 31st of July as she is shielded. I said that will be 5 months out of the life of an 89-year-old woman with dementia, who incidentally suffers life-threatening infections associated with having a catheter every other month. I am and was my mother's main carer for many years. She only went into a care home 6 months ago after a fall. It is an act of outright cruelty to deny her the company of her children at this stage of her life. She has no understanding of the virus. She will simply feel that we have abandoned her. I believe that what you are doing is a major breach of our right to family life. And at the end of the letter I said, I am extremely angry that through the entire epidemic, neither you nor the First Minister have ever directed a single comment directly to care home residents or their families, explaining what your strategy is and what you are seeking to achieve before we can be reunited with our loved ones, assuming they survive that long. I watch the briefing every day and see all the different groups addressed, from care workers to unpaid carers, but never us. Perhaps you simply can't look people in care or their loved ones in the face.
Yeah. Do you recall if you got a response to that?
No, I don't think I got a response to that one.
Okay. Right. Now, looking at one or two other particular points, and I am just selecting some of these, Mrs. Russell, for emphasis. Paragraphs 98 to 100, you tell us about an opportunity that your grandchildren, again, can I just remind you not to name them, your grandchildren, I suppose your mother's great-grandchildren had an opportunity to see their great-grandmother. And how did you feel that went?
It didn't go very well, that visit, because it was a closed window visit. They still are. I think some care homes started outdoor visits in July, but my mum's care home had someone who was detected as having COVID through the national testing. The home were pretty certain that they didn't have anyone with COVID, and this person was never ill, but they'd had a positive test result through the random testing that was happening nationally, and so they were actually, the care home manager actually told me she was really pleased that as a result of that they would have to shut for another 28 days and couldn't open to outdoor visiting. So I was continuing with the closed window visits, and I'd gone down there with my daughter and grandchildren, but it's very noisy on the street because it's Crow Road in Glasgow. It's a very busy road. Main road. And she was looking. The children were trying to. It was sunny, and the children were trying to see through the window, and they were crouching down and looking. It was like when they were stood up, there was too much reflection. They were trying to see almost like underneath the window. So I've got a photograph of them crouched down trying to see their granny, and I found it upsetting because I just reminded me of going to see the meerkats in Aberdeen. You know, I thought this just isn't normal. It's a gorgeous day. Everyone else can go outside. Why can't we be sitting at one of these tables with my mother and her grandchildren playing around? Where would the harm have been in that? There wouldn't have been any harm in that because we could have maintained distance. We were supervised anyway, and we could have maintained some distance and been outside with those children. But she never got to see any of her great-grandchildren again. That was the last view she had of any of them.
Right. And obviously there are two sides to an interaction like that. There's your mother's perception of it, And obviously there's also, in this case specifically, your grandchildren's perception of it. First of all, your mother, do you think she gained any benefit from it?
Probably not.
Any grandchildren?
No, I don't think so. I think it was just sad.
Now, we can read what you say about outdoor visits, and we've got everything you've said in relation to that, but can I take you to paragraph 124, which is an incident just before Christmas 2020. And this was an occasion when you had gone to see your mother. Where was that taking place?
Well, I had never had any indoor visits because the care home, because of the way Glasgow shut down, very few care homes had they had to have a risk assessment, which they believed had to be signed off by public health. And that had never happened in my mum's care home before the Glasgow shutdown came in. So as a result, there was never any indoor visiting in Glasgow. But it did reopen again just a couple of weeks before Christmas. But it was my mum's care home had just had an outbreak in November, and they were not for opening up again. But I think the chief nursing officer had spoken to the local. I think they felt so sorry for me actually because I'd been fighting for so long and still hadn't got in, and they arranged a visit. They finally agreed I could have a visit in the foyer, but it wasn't any better than an outdoor visit. The outdoor visits were horrible. They were like prison visits when they could have been good because my mum loved the outdoors, and we could have been sat at a picnic table and had, something to eat and drink, and, you could have made that an occasion. It wouldn't have done everyone in a care home because a lot of people couldn't take the cold or they wouldn't be well enough to come outside. But my mum would have been good with that, but it was never allowed. She was always kept in the home, and all that an outdoor visit meant was that the doors were open.
And you were outside? And
I was outside. But what they arranged before Christmas was an indoor visit, which was in it wasn't. I mean, my idea of an indoor visit was what we'd been promised on the 12th of October, in your mother's own room with touch. But it wasn't that. It was outdoor. It was indoors, but it was just the same as an outdoor visit. I had the full PPE on to sit kind of about 3 metres away from my mother, who was in an in-shot, and it was in a foyer, so there was lots of people coming and going, and it was overseen by reception. And my mum, at one point, she sort of reached out to me and said, give me a hug, and she leaned really, really far forward, and I thought she was going to tip the chair up. And so I ran over to try and stop her, and the person behind the reception went absolutely nuts and was screaming at me, get your hands off her, get your hands off her. But I had been tested and I was wearing exactly the same as everyone else.
I think you say you don't blame the employee.
No,
you say there was a real fear, I think it's of culture around COVID.
Yeah, they were traumatised. I mean, they'd had an outbreak, they'd lost 10 residents. Well, I didn't know that at the time, but I found it out in April when the BBC finally managed to get information on the number of deaths, because that was always considered commercially sensitive information. I couldn't understand that because I had worked in emergency planning teams that looked at COVID, that had looked at E. coli and Legionnaires and all of these things. They never gave us stuff about who they named that had caused if there had been any kind of outbreak. But suddenly in COVID it was commercially sensitive and we weren't to know how many deaths there were.
Yeah. And I think you say that you could see that your mum felt very embarrassed about you being told off.
Yeah, she did. I mean, yeah, she wasn't very pleased. But she did say after that, I actually videoed her that day, and she said that she didn't care about COVID or anything else. She just wanted to see her family.
Yeah. There was an occasion when the care home contacted you in January 2021, asking if you could arrange an assistance taxi to take your mother for a hospital visit. There was an infection she had.
That's right. It was actually, I had been saying to them, because my mum kept getting UTIs, could she not get prescribed preventative antibiotics, which she had a relative who was on those, and they seemed to be quite effective. And they said that they would... so I didn't hear any more about that, but then I was really surprised at the beginning of January when they said that you could take your mother to a hospital appointment, and I just went and got a PCR test a few days before, and book an assistance taxi and took her over to to the QE.
Yeah.
And I told her that we were like Thelma and Louise and we were going on a road trip. And on the way back, I got the taxi driver to take us to the Botanic Gardens. And we sat on a bench in the Botanic Gardens. Well, my mum was in her wheelchair, but you know, I was on the bench. And she sat and watched a wee child playing in the field and with bubbles or something, and she just sat and watched that.
I suppose the Glasgow Botanic Gardens wasn't quite the Grand Canyon.
No.
The Glasgow taxi probably wasn't a Ford Thunderbird, but you both survived it.
I knew it was a place that I could go and easily get a taxi back again, you know, if they dropped me there.
Yeah.
So it was, but the thing about these one-off visits, like the one I got just before Christmas and then that one in January, was that when I took my mum back, I had to leave her just in the foyer. I wasn't allowed to settle her in or anything. I just to leave her in the, you know, the kind of before you go indoors at the home, and I just to leave her there, and I had no idea when I would ever see her again, or if I would ever see her again.
Right.
Because there was no visiting at all at that time, because that was after the Boxing Day shutdown.
You tell us about your mum's death in paragraphs 141 to 149, and I appreciate that will be upsetting for you, and I don't want to go through that in any detail. Your mother had, I think, requested a DNR some years ago.
Yes, I'd actually been at the doctor's with her that day, and the doctor had mentioned it to her, and she said, oh yeah, I would sign that because I don't believe in...
Yeah. And what you say is that it was apparent that your mother's system was shutting down.
Yes, the GP had phoned me and he said they could move her. In care homes, they can't put a line in to do antibiotics. I don't know if that's changed now, but at that time they weren't allowed to do that. But when he phoned me, he said, if you really want that to happen, I'll see if I can get her moved to hospital. But he said, to be honest, I wouldn't advise it. I don't think it'd be effective. I think she's... The expression he used was it would just soak her skin. It wouldn't work. And I could see she was going. I could tell myself.
And as we noticed earlier, she received the last rites from your local priest.
And my mum's death was in the context that we had quite good access from March on. Well, good compared to what it had been. I was getting in once a week from March. My sister was getting to take mum out once a week from March, and I would go and meet them at the park, you know, in the wheelchair, with my mum in the wheelchair, and take a picnic with us. Then from about, you know, in late April, May, I was allowed to take mum out on Sundays as well. So I was taking her home on a Sunday. So I had quite good access for that 3 months, and I think psychologically that's made a massive difference because we had some really nice times, and she was really, and I mean my mum, the care staff absolutely loved her. I mean they were really. I still visit that care home, and that's the difference. I go to the care home now as a visitor to see a lady who I used to work with who's now in there. And if I arrived there one day and they said, I'm sorry, the home's shut down, we've got an outbreak, I would accept that because I am that person's visitor. but I wasn't my mum's visitor.
No, we understand that. Your brother was also allowed in at the end of your mother's life, but I think you had to argue his case.
Yes, I did. The visiting coordinator said to me, when I said my brother will be arriving on Sunday, she said, oh, well, he'll have to sit behind a screen. And I said, look, my brother has been looking at his mother on a screen for 14 months now with a Skype call every week. He's not sitting behind a screen. I said, this is an end-of-life visit. And she said, well, no one's told me your mother's at end of life. But that was just a week before my mum died. But, you know, because I said, no, well, she is. And so I don't know if she made inquiries, but when I met my brother, I mean, we didn't go in together or anything, but when I met my brother in the street, I said, look, if you've any problem, phone me. But he said it was fine. He didn't have to sit behind a screen.
Yeah. And
but I didn't know that would be happening to loads of people. You know, the only reason he got in was because I knew the rules. And people that didn't know the rules would just be getting told no.
And I think you were with your mother when she passed away.
Yes, we were there. And my mum's end-of-life care, and generally her care in the care home, they were lovely. I mean, I haven't... The one thing I was angry about with the home was that they would never consider me for essential, and I felt I did meet the criteria for essential visiting. And even where my mum didn't meet it, I felt I met it because of the levels of distress that I was feeling.
Yes. Yeah. Yeah. Now, I think you also say that your mum's funeral was one of the first normal funerals. We had 100 mourners at it, and then other people at a
it was exactly
lunch
she would have wanted it.
Yeah.
It was just how she would have.
Yeah.
She always wanted a good parfait with steak pie and all that. So yeah, it was no, it was good, and it was a lovely service, and I think. Yeah, I think that made a huge difference to how I have coped compared to, I think, probably the people who are almost, you know, I know you can't ever compare different people's grief, but I think people who lost a relative in that first year before they ever got in again, they are really suffering. I see it every day, and my whole life has changed because I spent my life on that group.
I suppose for you there was an element of normalcy came at the end. There was an element of normality came at the end of your mother's life.
At the end, but by the next winter we were back to square one. There was lots of people not getting in. There was lots of people who were they'd really get into isolating people really badly that year. I mean, that was terrible. There was people being isolated for. People were coming in the group saying, my mum's been stuck in her room for 45 days. You know, and you sort of thought, where's habeas corpus in this? You know, I mean, surely you cannot bang people up in a room for that length of time. And I said to Graham Ellis one day, you know, surely, how long would you consider acceptable to keep someone in prison like that? You know, you just cannot do this. And he is the chair of the CPAD group. And he hasn't been redacted on anything I've got. And you know, I just couldn't. I mean, we all argued that one out because we just couldn't understand why anyone could think that was okay. And because care home rooms are smaller than prison cells in a lot of cases. I mean, my mum had quite a decent room, but you know, a lot of people that were saying their relatives' room was tiny and they were getting stuck in there. And because they came out and happened to brush past somebody else who was subsequently found to have COVID, they were getting put back in. And this was going on and on and on. And so that it was just as bad. That winter was really, really bad for people. And we spent so much time. I mean, my life changed because I was basically became... I mean, we were... Alison and I, we were basically running a 24-hour call centre for folk that were distressed, that were getting stuck out, that weren't getting in to see dead relatives, or relatives who were dying, and we were having to threaten people. We were having to go, you know, and we were running about going to the care inspectorate. We were going to, in the first year particularly, it was the nurse, the chief nursing officer, and her staff were quite helpful. But then they wouldn't manage to get them in, and then you go to Scottish Care, and then they wouldn't. And sometimes what got them in was me threatening them with a Sunday meal. I mean, that happened on a few occasions where I just had to say, well, I'm sorry, but if they're not letting them in, tell them this is going to be in the front page of the Sunday Mail this weekend, because this is scandalous. You know.
Can I ask you to look at paragraphs 150 and following, the impact on you and on your mother? Again, as I said earlier, two sides of this. You say at 151 that you are aware that your mother definitely declined cognitively.
Yeah, our life was peopled by folk who'd been dead for 30 years. I mean, she just spoke about her mother and her brothers and sisters, and I seen her such and such, and her, you know, I don't know if I can name dead people, but she would just say, and so she just had lost all her bearings, and I think, and every now and again she would, you know, she would look at me once I was back in, and she would say, they're dead, aren't they? You know, it was like a penny would drop, but I think it was quite, that probably wouldn't have happened if I'd been seeing her quite regularly. I don't think she would have gone, because whatever damage, my mother, I would say, was almost like it was some sort of types of brain damage, but in other ways she was still really sociable and really good company. And
you didn't get essential visits until the last fortnight of her life.
That's right, yes.
And I think that's obviously a point that, put it this way, rankles with you still.
Yeah, well, on behalf of everyone really that was in that situation, I just think that I mean, I always said to, can I name the head of Scottish Care?
I think probably not, if you don't mind.
I mean, I always said to him, to Donald McCaskill, you know, President Macron, instructed the care homes in France to open in April 20, and to relatives that you couldn't keep people away from their relatives like that. And he said, oh, but they got indemnity. So I did wonder if my mum was just a hostage, you know, trying to get the care homes indemnity.
And I think you repeat the point about her feeling that she was a prisoner.
She felt she was I think she did feel she was a prisoner. I think it was a tragic. I think my mum had a really good life, and we, you know, we had a lot of good times together, and I'm really glad that I did get back in for that, you know, to enjoy her company for that last wee while. But I didn't see a need for it. I thought that there is a care team that looks after. I mean, a person in a care home can't survive on their own. They have a team of people that look after them, and to make one of those people somebody that loves them and cares about them and really wants to provide that emotional support and that memory for them. I mean, I actually had, you know, Graham Ellis actually put up on Twitter one day a quote from one of my letters, which was, you know, I was my mother's carer, I was her memory, I was this, I was, and yet the odd job man in our care home has more rights to see her than I have. And he actually had used that quite early on, but it was another 9 months after that before I get in. It was nearly a year since after Donald McCaskill said to me, yeah, this is terrible, we have to get the balance right. And you know, because he wrote to me in the April, and yet it was the March the following year before I got in. And it was the same for, I mean, I was lucky in the end, but, you know, I was reunited with my mum, and I can look back on it all and think, well, over the whole piece, you know, we had good times together, and she had a great life, and I was very, very fortunate. But I see the things that have happened to people. You know, a lot of the people that phone me, and it's been desperate. I think when you look back in COVID, this will be the treatment of people in care homes will be the standout disaster.
Right. Mrs. Russell, time is against us, I'm afraid. So can I just take a few more points from you? You say at paragraph 158 of your statement that if you'd known it would be a year until you would be able to get back in to see your mother, you are sure that you would have done things differently. By that, I take it you mean that you would have tried to accommodate her and her needs in the community.
Yeah, I mean, well, if it had happened a month earlier, you know, I'd still had her home, I could maybe have got her back out to that. And I did, I mean, I was thinking through everything. I'd moved into a modern flat, and there was a one-bedroom flat in the building, and I went to ask about that, but it had been sold, because I was thinking maybe between us all we could try and get that and move her in there. But I know from my experience in the group that people found it very, very difficult to get, because my mum would have needed quite a lot of medical input, and I probably wouldn't have got the nursing.
Could you read, please, paragraph 162?
I'm sorry, I couldn't read that.
You can't. That's all right. Don't worry. We can read it. You do mention spiritual support, and we have that in your statement. Some thoughts of what went wrong in the pandemic, as we'll find that at paragraphs 185 to 193. Can I just deal with a couple of points that you mention? You say in paragraph 185 that at the very outset you were asking the obvious question, and you go on to say that you feel that a kind of groupthink took over at meetings of government and public health. Why do you think that?
Well, I just can't understand why. I mean, I would love to know, and I hope that the inquiry can find out what the conversations were in the room. But I can't understand why, like one of the guys that's phoned me throughout this, he's not on the group because he doesn't use Facebook, but I mean, he goes to visit his wife, and even when he finally did get in, and there were some dreadful things happened on the way there, and when he did finally get in, if his wife went on a wander, he wasn't allowed to follow, so he could spend his entire 30-minute visit that he was allowed in that room on his own, because he wasn't allowed to follow his wife out into a corridor to bring her back.
Was the issue...
To your evidence, poor Mr. Gale's trying to get as much out of you as he can, and you are going off at a tangent quite a lot. Stick to the question so we can get the relevant information.
Just in relation to that, you say you were asking the obvious question. Do you think at that time that the issue was obvious, or should have been obvious to those who were taking decisions?
I think they should have. I think the difference between having one essential caregiver having access and having nobody having access would have been enormous to families. It would have been incredibly reassuring if one person was getting in. Now, in a lot of care homes, a lot of the people don't have anyone who would be in that role. So I don't think it would have put their numbers up by the number of residents. But I think for those people who were devastated by what was going on, it could have made an enormous difference to have had that level of contact. And I think that could have been easily mitigated by ensuring that these people were following the same rules as the staff.
Just one other point. It's a point you've made on a number of occasions in your statement. I think you compare the situation that you were in as a loved one and a devoted daughter to your mother, and others, if I can put it this way, and it's how you put it, saw visiting their relatives in care homes as, and I think using your words, a duty call. Do you think there was too much emphasis placed on the possibility that people were doing it as a duty call rather than there being the importance of a loved one and a continuing carer as you were?
I really don't know. I mean, everyone who spends a lot of time in a care home will see the awkward visits where people really don't want to be there. I mean, I'm not putting anyone down by that. I think that's just, you know, because they're not, it might be a distant aunt, or it might be someone that you don't know, you know, you're being asked to visit them, but you're not really all that close to them. I think there's a world of difference between that and people who are absolutely viscerally attached.
Yes. Lessons to be learned, if I can just take you to that. Obviously, the inquiry will have regard to everything you've said there, Mrs. Russell. And I think it's also right to note that you do recognise that the care home, in your mother's case, did get some things right.
Yes, they did. I mean, the care itself, I think, was very good. I know a lot of people got very distressed about that, but I always actually had confidence in my mum. Always looked well. She was always well dressed. She was lovely, and the carers were lovely, and so I think that was good. But also, I think they did very well with the online contact. I know that I would say that's a very small percentage of care home residents that's good for, but it did work quite well with my mum, and they were very good about that. And they were also good about handing stuff in. They didn't make a big fuss about it.
And the toasted cheese always got there.
I hope I'm not getting anyone into trouble here.
I'm sure you're not. Just in paragraph 202 of your statement, you make this comment, and it's one we've heard a number of times, and I think we will continue to hear in this inquiry. Perhaps you just read that through, please.
Yeah, the guidance was overcomplicated, overcooked. We kept asking for a single A4 sheet telling people what they should do, not what they couldn't do. All the guidance was written with an underlying threatening tone to the managers, and that just didn't help.
Yeah. Again, so far as the hopes for the inquiry, you set out a number of those in very articulate detail, if I may say. And we obviously will take those forward and consider them. What I would like you to do, if you can, is to go to paragraph 214 of your statement. And would you read the quoted section from the Five Nations statement?
Yes, I think we actually did this in our group statement, but it was finally, I hope the inquiry takes on board the Five Nations statement, which we issued with representatives from other countries, and John's campaign, which called for compassion and care. This summed up the whole situation so well. Over the months of the pandemic, the deepest ties of love, the things that make us glad to be alive, have been treated as unimportant. Spouses, life partners, parents and children have been treated as inessential to each other. Their wishes have not been considered, their voices have not been listened to. Residents of care homes have been shut in, those who love them have been shut out. People living in residential and nursing homes, for whatever reason, have been treated differently to the rest of society. They have had no agency. Those they trusted to speak for them have not been properly listened to. Their well-being has been compromised in the name of care. This is not the society we wish to pass on to the next generation or to grow old in ourselves.
Mrs. Russell, thank you very much indeed for providing us with that information, and I hope it's given you an opportunity to say what you wanted.
Yeah, thanks very much.
Thank you. Thank you, my lord.
Thank you, Mrs. Russell. That's all. Tomorrow morning at 10.